Good morning, folks. All right, I think we are ready to get started. Welcome here to our 2024 Health Workforce Summit. I am Jeanne Lambrew, the Commissioner of the Maine Department of Health and Human Services, and I'm excited to join Labor Commissioner Laura Fortman to welcome you here today. This full-day summit aims to advance Maine's progress in recruiting and retaining workers in the healthcare field by sharing strategies that have been successful in growing and upskilling talent. Before we say more about the summit, I'd like to introduce a special virtual guest, Governor Janet Mills. Governor Mills is the 75th governor of Maine and the first woman governor. She also has accomplished much in healthcare. I am proud to give a few examples of those accomplishments. First, Governor Mills at long last expanded Medicaid called MaineCare, which is providing life-saving care to over 100,000 people. Second, she led Maine through a global pandemic with nation-leading results, including one of the highest vaccination rates and one of the lowest death rates in the country, protecting the lives and livelihoods of Mainers. And third, during the recovery from the pandemic, Governor Mills prioritized investments in areas hardest hit by the pandemic, such as Maine's behavioral health system and its healthcare workforce. With that, let's take a look at the video from Governor Mills.
Hello, this is Governor Janet Mills, and I'm sorry I couldn't be with you today in person for the 2024 Health Workforce Summit, a conference dedicated to advancing the progress that we've made since the pandemic to recruit and retain talented workers in the healthcare field in Maine. The healthcare industry was hit particularly hard during the pandemic, as nurses, doctors, and other frontline staff struggled to limit the spread of this deadly contagion. During that difficult time, I mobilized a group of experts to recommend to me ways to stabilize and strengthen our economy and our workforce. That work ensured that when the American Rescue Plan was passed by Congress and signed into law by President Biden, Maine was ready. We then created the Maine Jobs and Recovery Plan, which the legislature approved, to use nearly $1 billion of those federal funds to build a more prosperous economy. Through the Jobs and Recovery Plan, we invested more than $20 million in Maine's vital healthcare workforce. First, we created and expanded job training programs to recruit more healthcare professionals, to create advancement opportunities for them, and to expand the pipeline for those professionals into the future. So far, more than 2,200 people have participated in programs to learn to be CNAs, EMTs, pharmacists, and dental assistants, for instance. Secondly, we created a tuition reimbursement program to allow frontline healthcare workers to advance their careers through free or low-cost training programs. So far, more than 1,000 people have enrolled in training at no cost to them or their employer. Thirdly, we increased funding for scholarships and student loan relief programs through the Finance Authority of Maine and Doctors for Maine's Future scholarships to enable more people to become physicians or behavioral health specialists, long-term support workers, emergency medical services staff, and other health professionals. And finally, we expanded access to clinical placements for trainees in rural Maine to make sure that every person can get high-quality health care no matter where they live in our state. These investments have made a real difference. Since January of 2022, Maine has more than recovered the number of healthcare jobs that we had lost during the pandemic. In fact, today, more than 111,000 people, nurses, doctors, paramedics, and others are providing quality health care across Maine, a nearly 10% increase since January of 2022. Since my first day in office, I've worked hard to make health care more accessible and affordable for people in our state because I believe that we cannot have a healthy economy without healthy people. The pandemic only reinforced how important it is to have a strong healthcare system in our state. I'm proud of the progress we've made, and I'm proud of the progress we will be making over the coming years. And I hope you have a productive summit. I thank you for all you do to protect public health in the state of Maine.
Thank you, Governor Mills, without whom we wouldn't be here today. And thank you all. The Mills administration's partnerships with healthcare organizations, large and small, has both improved the health and well-being of residents and helped attract businesses and workers to Maine. Before turning it over to Commissioner Fortman, I'd like to say a few words as well. It was over 5 years ago that the Department of Labor and Department of Health and Human Services met on how to organize work around this sector. From those conversations, we decided to hire a DHHS Director of Healthcare Workforce. Joy Gould has held that position for 4 years and has been the force behind this conference. Join me in thanking both Joy and the Planning Committee, whose names have been shown on these slides, for the good work of bringing us here today. So even though workforce policy is fully in the purview of the Department of Labor, health policy is what we do and what you all do. People who gravitate to healthcare jobs often do so for its mission. The ultimate goal of health workers is simple, even though the work to achieve it is complex. We do work in this field to ensure babies are born healthy, that children who are injured or experience a disability can heal and thrive, that adults with cancer or heart disease who have been injured or who have an infection can get world-class scientifically based care, and that our older residents receive quality long-term services and supports in the setting that they prefer. The heart of healthcare is its workforce, so it is fitting that we gather here today to share best practices to support and expand it. This summit brings together health and human service employers, educators, workforce development innovators, and others to share best practices and opportunities, resources, and strategies. We'll place a special focus today on developing a new workforce models to advance health equity and healthcare access for rural residents and other underserved populations. The sessions are centered around 3 key areas: recruitment, training, and career ladders, and growing the provider pipeline. And I hope you all leave here today with new tools, tips, and partnerships that make Maine stronger. Thank you all for being here, and thank you, Commissioner Fortman.
Good morning. I'm Laura Fortman. I'm the Commissioner of the Maine Department of Labor. Thank you, Commissioner Lambrew and team, for pulling today's event together, as well as for the close partnership that we've shared over the last 5 years. As you've already heard Commissioner Lambrew and the Governor talk about the importance of the healthcare sector, particularly as it was highlighted during the pandemic, I won't rehash some of those numbers, although they are pretty impressive. The fact that we are investing and have been investing in our healthcare workforce, and that today we have more than 111,000 people, including doctors, nurses, paramedics, and other professionals in the field, and that 10% increase in the field since January of 2022 is truly remarkable. Prior to the pandemic, Maine was facing a tight labor market. We are the oldest state in the country, and we have currently about 2 open jobs across the economy for every unemployed person. So the fact that the healthcare sector has been able to recruit additional people at this time says a couple of things. I think, to Commissioner Lambrew's point, it talks about the commitment of people to this profession, as well as the targeted investments that have been made to promote opportunities in the sector. One of the key areas of focus in the Governor's Maine Jobs and Recovery Plan was to strengthen healthcare workforce through encouraging people to pursue healthcare jobs in Maine, to make it more affordable to become a healthcare professional, and make it easier to advance within those careers. There's a panel that's going to come immediately after this that will delve deeper into what we, and by we I mean collectively, all of the people in this room, as well as state agencies, the higher education system, what all of us have been doing to reach our goals in the areas. But I also wanted to talk a little bit about how these efforts have been making a difference in the lives of Maine people. People such as Alyssa True of Saco, who wanted to go into the dental field because she experienced dental anxiety and knew how challenging it was to get that care that she needed. She was concerned about how to afford her tuition. Through our Healthcare Training for Me program, she was able to pursue her education without the added stress of figuring out how to finance it. She said, I'm quoting here, "After completing the expanded functions dental assistant program, I will be able to get more involved with patient care, which is one of my primary goals. I will be able to place fillings in patients' teeth, all while helping create a safe and relaxing dental experience. Not only do I get to have the career I want, I'll also be able to support myself financially." Another example is Sefulala Naveed, who moved to Lewiston from Afghanistan, where he worked as a pharmacist for the U.S. military. One of the Career Center's healthcare navigators assisted him in getting a job at Walgreens as a pharmacy technician, and he can now focus on learning the American pharmaceutical system and working toward becoming licensed here as a pharmacist. One of the things that we hear repeatedly from adults as they're looking at how to advance their career is how to balance that needing a paycheck at the same time that they need to have a career. And we are identifying more of those earn and learn opportunities for people, such as Alexis Casey of Glenburn, who moved back to Maine and heard that the local career center would be a good place to start her healthcare job search. A healthcare navigator met with Alexis to explore healthcare jobs and career pathways, which resulted in her securing an earn while you learn position as a direct support professional and then upskilling to a new position as a certified residential medical aide. She said, "As a result, I have gotten a job, training, and now an even better job with career potential." Through just the Healthcare Training for Me program, over 1,000 current healthcare workers have been upskilled. The Healthcare Training for Me funding application is still open, so I just want to point that out. There's still an opportunity to enroll. We are accepting applications from employers as well as individual workers. I encourage you to take advantage of this opportunity as well as other partnerships that you learn about today. Your partnership over the years has been crucial in informing, developing, and implementing these workforce development programs, and your continued commitment as a workforce partner will be essential to expanding upon the progress we've made so far. Thank you so much again for being here. I hope you enjoy the day's discussions, and I look forward to continuing to work with you and your organizations to strengthen and support our healthcare workforce.
Good morning, everybody. Are we here? Good morning. I'm Sarah Griffin. I'm going to be emceeing for you today for a really exciting day that brings, as Commissioner Fortman and Commissioner Lambrew said, brings together employers and educators and trainers to do what we all need to do for Maine's healthcare workforce. So just want to give you a quick preview of the morning. We're going to start with a keynote. And I'll introduce our speaker in a moment. We're going to then we'll have a brief break, move to some panel discussions, come back together for another session, and then we'll have lunch and keep rolling. Sound good? Everybody ready? All right. So I am very pleased to be able to introduce Joanne Pokaski. I'll tell you why in a second. She is the Assistant Vice President of Workforce Planning and Development at the Beth Israel Lahey Health Systems in Massachusetts, the second largest private employer in Massachusetts with 38,000 workers. She is also the chair of the Massachusetts Workforce Board and a member of Boston's Workforce Board. She founded and for 7 years chaired the Boston Healthcare Careers Consortium, which convenes Boston's healthcare employers academic institutions and workforce system to improve training pathways that lead to healthcare jobs. Very much what we are hoping to talk about today. Joanne was a founding member and for 3 years chaired the Executive Committee of CareerStat, which is an initiative of the National Fund for Workforce Solutions that is really encouraging more U.S. healthcare employers to invest in frontline workers. Prior to her current role, Joanne served as a director of Boston Career Link, a one-stop career center in Boston. She also worked with the Clinton White House as a special assistant to the administrator of the Medicare and Medicaid programs. And we are very happy she's here. On a personal note, Joanne and I worked together, 15 years ago on an early generation career pathways program in Boston. So it gives me particular pleasure to introduce Joanne Pokaski.
Thanks, Sarah. I think we're closing in on 20 years ago, but we were both in our teens at the time. Good morning, everybody. I'd love to just see who's in the room. So could you raise your hand if you're representing an employer? Oh, lots of employers in the room. Good, nice. How about the education system? Any part of education? Excellent, great to have those partners here. How about workforce training partners? And you can raise your hand again if you're an educator, too. How about government folks? Career centers? All right. Welcome, everybody. So I'm very excited to be here. Sarah talked a little bit about my history. So I did work in healthcare, and then I ran a one-stop career center, and I loved that work. Just helping people connect to jobs is so important, and it really resonated with me. And then one day I got a call that Beth Israel Deaconess Medical Center, which is a academic medical center in Boston affiliated with Harvard University, they were looking for somebody to start up a workforce development program. So I was going to move to the other side of the table, right? So I went from helping people find jobs to being an employer. And I did a lot of thinking about what does it mean to be a good employer in this space. And then about 5 years ago, Beth Israel Deaconess Medical Center became part of a system, the Beth Israel Lahey Health System. And now I'll actually flip my slide there. So we're in Eastern Massachusetts. We've got about 15 hospitals, including Southern Exeter Hospital in Southern New Hampshire. And we've got about 38,000 employees. We also, since the pandemic, have about 4,000 jobs we're really struggling to fill. And as quickly as we fill them, we lose people as well. So we're really trying to figure out not only how do we bring people in, but how do we retain those folks as well. And that retention piece is really important and an important part of the work that we all do. So I like to think of our work as how do we bring people in and then help them grow their careers with us. And that is good for our employees because it helps them continue to move up and earn more money and build skills and support their families. It's good for the hospital because the hospital systems, when we find people who are able to come and work and like it, let's keep them here and let's help them grow. And you know, knowing your way around one of these institutions and building skills is so important, and you add so much more value. And then it's also good for our communities because we want to make sure that people who are living near our institutions feel very welcome and see themselves as working in our organization. So I'm talking about innovation and collaboration. I'm going to talk about some of the things we do, and then I'll pause and take some questions, and we'll talk about some collaborations. Keep in mind that I've been at this for 20 years, so this didn't happen in 2 years. But I want to talk about some of the things we're actively doing right now, and hopefully that generates some interest. So I think of our work in 3 buckets. One is pipeline programs. How are we training people up into jobs that we're having trouble filling? It's a demand-driven strategy. If we are not having trouble filling it, we're not training people up to it. The second is how do we support and invest in our employees and their skills? And then the last bucket is how do we make sure that people who live near our institutions know they can connect into us, get a job with us, and build a career with us? So pipeline programs. These days we're offering a lot, again, because we're having trouble finding people in all different jobs. So I would say pre-pandemic, we struggled a lot with allied health roles. Now we're struggling with almost everything. But it's given us some opportunities. So where before we might say, okay, medical assistants, if you go to a program, we'll hire you. Now we're saying, medical assistants, please come work for us. We will train you and we'll pay you starting day one for an 8-week training and then have you move to our job. So we were able to use ARPA money to run a program where we identify a group of people who are interested and feel like a good fit. We train them for 8 weeks, and they are working as medical assistants in our primary care practices around the state. So it's a really different model, and it's going really well. At the 1-year mark, people can be certified and attain that certification. We also are training nursing assistants and patient care technicians in our inpatient acute care hospitals. We've been doing this for a while, so we bring people in, and in 3 to 4 weeks, we train those folks, give them a lot of experience on the floor so they know exactly what they're getting into. And that can really be site-specific, so we try to do that training right at the site and move those folks into patient care technician, nursing assistant jobs. Pharmacy techs is another area that we've struggled with, and we've figured out a model to bring people in. We're working with Pharmacy Tech University, which is an online training. So people do 4 days a week hands-on with us, and then they'll spend a day at home doing Pharm Tech University. And in 4 to 5 months, so they're being paid the whole time as employees with us, and in 4 to 5 months, they're able to be certified as pharmacy technicians. We also have another program because at some of our more acute hospitals, they like people to come in more fully baked. They're like, we don't have the time to train people up. So we also work with a program at one of our training partners, JVS, and they find people in the community, they provide the didactic training, and then they come to us for externship. And if they're successful, we move them into a job. So those are some of the things we're working on. We have some other things going on too. Before the pandemic, at BIDMC, where I worked, we did not have trouble finding nurses. I know that feels hard to believe right now, but we did not have trouble finding nurses. What we had trouble finding was diverse nurses who wanted to work with us. We were trying to have a workforce that reflected our patient population, but that was really not, our nurse workforce was not reflecting that patient population. And we were like, okay, if we want a different result, we need to think differently. And so our chief nursing officer at the time brought together a group of Black nurses and said, what are we doing wrong here? And they said, you've raised the bar to require a bachelor's degree for entry, but that, I think, is really limiting who you're bringing in. And, it's pretty common among nurses that the bachelor's degree is preferred. The Institute of Medicine said it's better to have bachelor degree trained nurses, but we needed to think about how do we bring in diverse nurses and also have that bachelor's degree requirement. So we started a program where every year we reach out, we find nurses trained as associate degree nurses, and they do 8 weeks with us, hands-on, and then they take on a nursing caseload just like anybody else, but we're also sponsoring them to get their bachelor's degree in 2 years. So at the end of those 2 years, they're a CN2, like everybody else, and they move on. But it's really, we brought a lot of great nurses in through this model. And also, since that time, it just became harder to bring in nurses, period. So it was a great way of bringing in new nurses to our organization in a time of nursing shortage. So that will continue. Surge techs are very hard to recruit for. And we are really struggling in Massachusetts with not enough surgical technologists. So we are paying travelers a lot more money to do that work. We've also, because this is what healthcare does to itself, we've raised the bar in terms of what we're asking, how we're asking people to train to that profession. So it used to be you could do a 1-year program and become a surge tech, but now you have to do a 2-year associate's degree program to become a surge tech. And this is some of the challenge of training this next generation of allied health professionals is who has the time to not earn money for 2 years and pay a lot of tuition to become this professional in healthcare? Not a lot of people. So we are doing a program right now with LaSalle University, which is one of the last colleges to start up a surge tech program, and they were actually grandfathered in to do a 1-year program. So we have 2 cohorts going through that program, but we are, surge techs have to do a lot of hands-on work, and we are paying our surge techs while they do hands-on work like our employees. So we're putting a lot of people through that program, but then the question that a lot of employers are asking is, well, what is next? And when we have to do a 2-year program, what is that going to look like? And how do we support people through that program? Because ultimately, we need people in that surge tech role. So we've been thinking a lot about that. And then one other group that my team does a lot of work on is, for our incumbent workforce, we reach out on a regular basis to see if people want to train to be central processing techs. And those are people who sterilize the equipment in the OR. And we do collaborations with both Bunker Hill Community College and North Shore Community College for that program. So those are our pipelines. And what we've built up over time, and what's become more interesting in some ways, is our career development program. So it's great to have these pathways, but people are in different levels of readiness to take advantage of those pathways. And so we want to make sure that everybody is ready to take advantage of the programs that we offer. For some people, their English skills are not what they should be. For others, their reading skills are not what they should be, or math skills. So we offer a number of things. And we offered this at BIDMC, and now as a system, we've been able to spread this around as well. So all BILH employees have access to one-on-one career and academic advising. And this is just somebody on your team who anybody can go to and say, hey, I applied to 20 jobs and I haven't gotten one interview. Can you help me think about how to do this better? Or I'm thinking about going back to school. I don't know how to do that. Can you help me think about that? Or I want to go to nursing school, and how do I think about different options? So, or you know what, another one is, I had a bad day and I don't like my boss and how they talk to me, and I think I might quit. What should I do? So just to have somebody that people can talk to who's on their side and advising them is huge. And so I'm really proud of that initiative. We offer ESOL in a very rigorous program through JVS. It has become a virtual program during the pandemic, but that's been great for us because we have so many different sites we're trying to serve, and having a virtual program really makes sense. And I'm going to talk about this program a lot. I'm going to talk about this program a little later because I think it might be of interest in Maine, where so many sites can be really spread apart. It could be an interesting model to look at. We decided to offer free community college courses to our employees. So again, when we were training people up to be surge techs or other things, we found a lot of wonderful employees who weren't quite academically ready to do this work, and we wanted to help them get ready. And you know, when you take a program like a rad tech program, you're taking like 2-3 courses at a time. We want people just to take one course if they need it and figure out, what is it like to take a course? Am I ready? Get some success, understand what it's like, and then take on more and more. So we think of these as kind of platform programs for our employees. We offer career development workshops, so any employee can go to a resume writing workshop or go to a workshop on how do you get ready to prepare for an interview. We want our folks to be successful in moving up, and part of that is giving them those tools. We also offer financial fitness workshops because people are suddenly making money and we want them to use their money wisely. How do they get out of debt? How do they spend down their student loans? How do they save for college? How do they save to buy a house? What's the best way to finance a car? These are some things we think about. And then another exciting opportunity we've put together in the last few years is we decided that we wanted to offer an MBA program for people who work at BILH. So we did an RFP, and we put it out to all the different MBA programs in the area, and we got a lot of wonderful responses, and we chose Bentley as our partner. So employees who are interested in getting an MBA who work at BILH get like a 40% discount, and they come together as a cohort. They go through this as a class, and as long as they're working with us, they continue to be part of that class and work in that cohort. So that's been great retention and career advancement for our employees. And I also want to talk about the Pathway to Nursing program. So this is something we're gearing up to launch. So you've heard me talk about how we're trying to bring in more medical assistants and nursing assistants. And then on the other side, we have a need for nurses. But that gap between the medical assistant and the nursing assistant and the nurse is really big. And it's a pretty hard step to take and navigate. So we are about to launch a program to really help employees think about what are all the steps you need to do to get yourself into nursing school and through nursing school and to that nursing career. And it takes a lot of what we've offered already and packages it up in a nice package of, okay, take those free prerequisites that we're offering, like biology or math. We will help you think about what's the right program to choose. We have tuition reimbursement. We have scholarships. Massachusetts now has free community college for people over 25 who take 6 credits or more at a time. Is that something you want to tap into? So we help people kind of put the whole picture together and think about a plan to move forward from there. Last year, about 1,300 employees received a career development service from us. And in that last bucket is community hiring, and this has really grown in the last few years too. We've got a dedicated staff managing relationships with over 70 community partners, thinking about training programs that need a place for the on-site training. How do we partner with those folks and make sure after people do the on-site training, they come work for us? Or a lot of career centers are just referring candidates who are ready. And this is interesting. When I ran the career center, it felt like a black hole. Like, people would apply online, they'd never hear back from the hospital. I would call the hospital, no one would return my calls. And it has to feel more transparent, right? We have to make it much more accessible to come work in healthcare. So my team answers every community-based organization's call. We build these relationships where they know if you've referred John Smith to us, you can find out how John Smith is doing in that process, and you can get feedback like, hey, John's not actually eligible for this job, but he could do this job, or John, is supposed to be giving us references and we haven't heard back from him. So really helping make that whole process more transparent and helping more organizations connect people to our opportunities. We are spending a lot of time, and I don't know, I hear this is a challenge, a new opportunity here too. We're working a lot now with people who are supporting new migrants to the state. And we've taken a bunch of different approaches. So we work with a group called African Bridge Network that believes that when you come here and you're a professional trained in another country, you don't have to start from zero. So we have paid, we pay half and African Bridge Network pays half, and there are paid internships to be a program manager, to be a manager, to do something different, and just get in more at the right level where you should be professionally and see if that sticks. So we usually host around 6 different interns a year in that space, and I think that'll grow. We have been able to bring in some Ukrainians who needed a job offer before they could leave Ukraine, and we're able to set that up and interview folks virtually and help them get a job offer and come work at BIDMC. And our new challenge is we have a lot of migrants who don't speak English, and we've had to think differently about, do we have opportunities for people in healthcare who do not speak English? What might we do? What is a supportive environment to do it in? And how do we help them take advantage of the English language courses we offer and help them continue to grow with us as a workforce? So we've done a lot of work in this space. We also do a paid internship program for high school kids at BIDMC. So why do we do this work? There are a lot of benefits. I like to think of us, and I've been talking about this a lot as a system. I think of us as the talent build strategy, right? If talent is available to buy, go buy it. But that can't be your only strategy, and workforce development is the talent build strategy. And sometimes the market is just not aligned. And by sometimes, I mean all the time. This market is never aligned. And, COVID really made it as misaligned as it could be, but this is never going to be fixed. The market is always going to be out of alignment one way or the other. And so you need people, as an employer, you need people to understand, where is this market misaligned, and what might we do to bridge the gap between where people are and what we need? And I think the more people you have on your team who can figure that out, the more you can just handle problems or issues as they come your way and get some creative thinking happening. And I think that's really important. Another thing that I think career development, what we do in workforce development, DEI is in our DNA. And if you're doing it right, you're thinking about diversity, equity, and inclusion every single day. And so I think we can talk about a lot of diversity stuff, but for your employees, often the workforce development programs are the DEI that impacts them and that they see. So I think that's really, really important, and to kind of take your space in that DEI lane and get to know your DEI folks and work closely with them and make sure they understand what workforce development is bringing to the table. I am going to take some questions right now, and then we're going to move to the collaboration part. So I've kind of thrown a lot of content at you. Does anybody have any questions right now? Yes.
You said that you were paying, or you were offering free tuition to the community colleges, and I wondered, is that, is your system putting that bill, or are you doing that collaboration with some kind of initiative from the state, or how is that working?
Good question. So there's two different things happening at the same time. So for a long time, we have partnered with some community colleges to offer courses like College English 1, basic math, pre-college reading, pre-college math, biology, anatomy and physiology. And we pay a college to train that, to offer that course, and we offer it exclusively to our employees, and we fill those classes. At the same time, what's happening now is the state of Massachusetts and the Healy administration has pushed out a new initiative called Mass Reconnect. So in that program, if you're over 25 and you're taking and you don't have a degree already, and if you're taking 6 credits at a time, you're eligible for free college. So I think the challenge for my team is to figure out how these things go together. Should we still be paying for these courses if you can get these over here, and things like that. So we're kind of braiding in different opportunities and making sure that people are taking advantage of the right opportunity for them. So if you're just going back to school, you probably don't want to take 6 credits and work at the same, and parent at the same time, right? That's a lot. But if you're somebody who's been doing it for a while and you just want to move forward, that'd be a great opportunity. Another question? Yes.
So I noticed in your bio that you are chair of the Massachusetts Workforce Board and a member of Boston's Workforce Board.
Yeah.
So as a director of one of Maine's 3 local workforce boards, what role do you see that the board playing in developing and encouraging, healthcare workforce?
It's a good question. And I think the state and the local boards are a little bit different that way. On the state board, I am the voice of healthcare and saying, and healthcare is still challenged. In Massachusetts, a lot of industries have rebounded, but healthcare hasn't rebounded, utilities haven't rebounded, and education hasn't rebounded because those are in-person jobs, and a lot of people don't want to do in-person jobs anymore. That's a big factor of it. So just pointing out on a regular basis, we need to be very focused on healthcare and what are the resources for healthcare and how are we thinking about healthcare, because if you don't have education and if you don't have utilities, education, or healthcare, a lot is going to grind to a standstill, right? And a healthy ecosystem needs all those things, but really pushing for that. I would say on the local level, there's definitely a few things. I don't know what it's like in Maine. In Massachusetts, the money comes from the state and comes out to the local level. So at the local level, there's a lot of decision making, and especially with ARPA money, there has been a lot of money. So it comes out, and then you need to figure out how are we going to spend it, who are we going to work with, right? So being kind of fluent in what is needed and constantly thinking about the needs is really important. In Massachusetts, we have 16 workforce boards, and they've been asked to kind of partner up into regions. So there's a Boston workforce board, but there's a greater Boston region that has 3 workforce boards together. And together they do some regional planning and thinking about, well, what does it mean? What are the jobs we're struggling with in healthcare and what should we be doing? And in Boston, that looks different from the middle of the state because there's more acute care hospitals in Boston versus doctor's offices and home health care or other healthcare entities. So really thinking about what is needed. I think the state and the local boards really need to be pushing out a lot of intelligence and data around like what is happening with our economy, right? Because things are changing and they're changing quickly. So how do we help everybody understand what's changing and get it and convene people on a regular basis to talk about where we should be going? Yeah. And we'll talk a little bit about some other things that we're doing with the local board in a bit. Got another question here.
The support for language access is really interesting. How are you all identifying and addressing other external barriers to employment, like childcare and transportation? I think is probably somewhat obvious in Boston, but what can we be thinking about here in Maine on those fronts?
It's a good question. Childcare is one we struggle with, and I'm not sure we've developed great answers there. As you think about our system, I didn't think that was the case when I worked exclusively in Boston, but now that I'm working in other areas, I'm like, wow, Boston is really easy to get to and from. And so we have a lot of hospitals like Lahey Hospital and Medical Center that don't have an easy way to get around, and there's not, this huge infrastructure of public transportation getting people around. So we're starting to engage in a lot of conversations around what does it take to get from this town to where this hospital is. And I think we're at the beginning of that journey in some ways, really trying to understand how we move people from A to B, and is it a carpool? Is it a car? Is it public transportation? How do we, So I think those are challenging, and we want to be in the mix, working to solve those things. But I will say, as an employer, we're not leading on that, but we are thinking about it a lot. And Beth Israel Deaconess is in Longwood Medical Area, and so Boston's transportation system is built in a way everything goes into downtown Boston, and Longwood is over here, but has so many jobs. And so the Longwood Medical Area over time built up a whole shuttle system to get people to this other area, and that worked out. But it's hard and it's expensive, and I think this is where philanthropy could play a really good role in piloting some initiatives to think about how we move people from A to B, because it is becoming a bigger and bigger issue. All right, Serena.
You mentioned you work with the career centers and other nonprofits around Boston. You work with the career centers and other nonprofits around Boston, and they provide you with job-ready candidates. Do you find that they meet that job-ready definition that you have as an employer? And when there's disconnects, how do you address it?
I think that's a good question. I think of our job as to be ready for job-ready candidates, right? And that I don't think we're good at getting people job-ready. I think that's too much to put on an employer. But we can do some things to help people out. So if somebody's in a training program, that's a little bit easier to be like, so if we find somebody and they're like, okay, you're in our 3-week training program, and here's the challenge we're having with you, we can have that conversation with people there because we are now providing that training piece. I think our best relationships are with training partners that are there with us, provide us people, and then, we're working with people, not robots, so things happen. But when things happen, kind of step up to that challenge, are there to be found, work with us around, is there a solution for this person? Is this going to work out? So nobody's ever going to get it 100% right, but I think if we can iterate the process and get better and better at understanding who's going to be successful here and how do we help people when they stumble to either get back on the right track or think about a different opportunity. So I think we get a lot of wonderful people. And I think the more you iterate a partnership, I think the better it gets. And some, we talk about 76 partners. Some of them work with us more frequently, and have figured out how to work with us, and some will kind of come in and then leave, and we won't hear from them again. It just depends. Okay, so I'm going to move on to the next part of the presentation, which is about collaboration. I'm very happy to have fellow collaborators in the room. So Serena Powell and I used to work together at Goodwill, and Sarah Griffin and I worked together at my early days, 15 to 20 years ago, at BIDMC, and Joy Gould and I have crossed paths, so it's nice to be here with collaborators. So, why collaborate? We collaborate for a lot of different reasons. We collaborate with training partners because we don't have the ability to confer certification, and we don't want to get into that business. In a time of high vacancies, sometimes in a normal time we would have trained people, but in a time of high vacancies, sometimes we can't add that stress onto our managers, so we'll outsource some of the didactic piece so that people can get that training somewhere else, and then we'll help them with the hands-on training. And sometimes we just don't have the expertise in-house, and I think ESOL is a good example of that. We collaborate with other employers. I just don't think that's a lose-lose proposition. So it's funny, like when I started, there was a very competitive atmosphere in healthcare, and if you're in talent acquisition, you're competing against the other hospital system to win this candidate. But we just kind of feel like we're trying to get more people into this business, and if we all get more people in the business, it will be easier for all of us. So we're really expanding the pie and not so much fighting over, the remains of the pie or how big a slice everybody gets. Sometimes it's great to work with another employer to get yourself to scale that you need. Sometimes it's great to work with another employer to try out a new concept that maybe you're not strong in. And I like working with other employers to advocate for systems change, and we'll talk a bit about that too. So, here's an example of a collaboration. My system with 38,000 employees, the Mass General Brigham system, which probably has 90,000 employees, Boston Children's Hospital, and Dana-Farber, we all put our students in the same ESOL program. Because we put all these students together, we're able to offer classes at 2 different times and 4 different levels. So it's just, we're bringing the scale together, and then now we're all offering this virtually, so people can be accessing this at all different sites across Massachusetts and into New Hampshire. So that's a great way of collaborating and getting more for our money at the end of the day, a better service for our employees. And then I thought this would be interesting too. With ARPA, there was a lot of money out there. We decided to go after that grant to train medical assistants to work in our primary care practices. But other hospitals had other things they wanted to do. Behavioral health has not been a strong area of my team because we're working mostly at an academic medical center. But as we became a system, there were some parts of the system that were interested in behavioral health work. So at the North Shore, Mass General Hospital's, MGB's Salem Hospital decided to do a behavioral health program with the North Shore community, the North Shore WIB, and also North Shore Community College. And they brought in Beverly Hospital, which is one of our system hospitals. And so we were kind of we weren't leading on it, we weren't designing, and we kind of came late to the process, but we learned a lot being in that, about what it takes and what is needed in that behavioral health market and what it takes. And we did a similar thing with Boston Children's Hospital, where they wanted to do a mental health professional role, and Mount Auburn, and I put it out to a bunch of different hospitals in our system, and Mount Auburn and Cambridge was interested, so they participated as, not the lead agency, but another employer in this space. And again, we learned a lot about behavioral health and what happened in that space. So another thing we've done is we've come together to strategize as employers. So back in 2010, we had a number of employers that had gotten pretty strong in terms of healthcare workforce, but there was a real disconnect between the employers and the community college system. And we decided to come together and all be in the room and talk about what was going on. So that was the start of the Boston Healthcare Careers Consortium. And there were people training, and there were employers, and there were colleges, and there were a lot of programs, but we weren't all talking to each other, and it got a little chaotic. But this has been a good group to bring everybody together in the same room and have good conversations and check around like, hey, we're thinking about starting this program, who would be interested? And get everybody in the same room. And so that's what we did. And you can see that, you can see the composition of who is in that group. So the gray area is employers, and I don't have my glasses, but I'm going to see I think education is the orange area, and training programs are another area. But everybody everybody who wanted to could come together. And it was a regular meeting, and it was very tight. And it took a lot to get everybody in the same room because there was not a lot of trust. So we worked on things together. And the first thing we worked on was just a list of all the training programs in the area, what was out there. It was non-controversial, it was just a list. But we were able to really kind of put in one place, here's everything that's happening in Boston related to healthcare. And then we kind of moved into some other areas where we looked at what are the ways our system is not aligned, and that's impacting people who want to work in healthcare. So we looked at why do we have different prereq courses across our workforce? Why don't we actually make sure that people are connected to jobs at the end of some of these trainings and that sort of thing? So it was really interesting kind of look at what's happening. And then the last thing one of the last big projects we did was we looked at if we, and this was led by the local workforce board. So it was sort of employers coming together, but it was a grant through ERA back then. And it came through the local workforce board, and they hired somebody who staffed the initiative and kept it going. And they convened the groups together. So this was a great role for the local workforce board to play, the Boston Workforce Board. And then we looked at, could the Boston Workforce Board provide some service to people who are graduating? So in Massachusetts, if you graduate from a community college training program, we don't necessarily track whether or not you got a job. And so this provided services to every community college training program that was interested to connect people to jobs and track whether or not people got jobs at the end of the day. And we learned a lot about that process. So one other thing I wanted to mention is CareerStat, which is the national initiative. So in Boston, it's been super helpful to me to have colleagues I can call and ask questions, and a peer support group. And CareerStat is really a national peer support group, so you can understand nationally what's going on in healthcare workforce, and more people can be inspired. There are a lot of employers in CareerStat, but there are also educational institutions and also training providers and others. And their job is just to bring people together and talk about the healthcare workforce and kind of lift up the system. Membership is free, and I put the website there as well if you want to sign up. And then you can get on their email list and learn more about what's happening in the healthcare workforce. So CareerStat does peer learning, and it will offer regularly having somebody talk about some sort of healthcare workforce training they're providing. They've got a resource center. They talk a lot about evidence-based practices, and they also have a peer recognition program, and I'll talk about that. So we thought it was important to recognize what does it mean to be a good employer in the healthcare space. So we created a program that set a bar in terms of if you are a good employer in the healthcare space, is your program sustainable? Does it have impact? Are you measuring results? Does it have some sense of equity and inclusion? And there's a whole set of standards. But I'm proud to say that over 50 healthcare organizations around the country have been recognized. I don't think there has been a Maine healthcare employer recognized yet, so I'm challenging you all to become the first one to be recognized. But we've seen recognition from Massachusetts and Vermont and New Hampshire. So that is most of my presentation, and I have time for more questions now. Yes? We're going to bring the microphone over to you.
Thank you very much. Well, I don't know if it's, yes, it is. So you just have been talking about the National Fund for Workforce Solutions and talking about the frontline workers. So I represent frontline workers for people with intellectual disabilities who, reside in group homes or independently, that sort of thing. Does that group also represent that sector of the healthcare industry?
That's a good question. I think we started with hospital systems and long-term care is included. I don't know that we have fully kind of made that spread to your industry, but I think it would be interesting to, the best way to make that happen is to become involved and talk about it. And I think more and more, especially in Massachusetts, people are seeing that connection as well. I'll get somebody back there.
I have a two-part question. You're talking a lot about recruitment. I'm interested in the retention once you do train folks. And philosophically, do you have a required minimum payback period just in your strategy?
Those are really good questions. I'm going to start with the payback period. So when we first started doing this work, we had people sign a legal agreement, and if they broached that agreement, if they didn't come work for us for 2 years, we were going to, pursue a legal. And then somebody broached it, and our legal team didn't want to go after them, and the optics on it are pretty bad, right? And so if we weren't going to go after them, which felt weird anyway, and so we kind of said, all right, I understand why we want to do this, and it feels kind of icky. And so it has to be more a leap of faith. And part of our job is to create this welcoming environment that they don't want to leave, right? And so there's always going to be the one-off who leaves. But if you're creating a welcoming environment, people are really grateful to have had that opportunity and to have grown with you. And healthcare is a really relational place. So people like staying around their friends and staying with those relationships they have if you're creating a welcoming environment. And when you're not creating a welcoming environment, that's when you're going to lose people at the end of the day. You can be the best trainer in the world, but if you're putting people in a tough situation, they may not last. So our current stance is we do not ask people to pay back, but we use language like, we'd like people to join this program, and we expect you to stay here for 2 years. So we say that a lot, and that's the expectation. We don't have a legal pin. In this market, we're questioning whether we should still be doing that, and we're having more conversations around if we are training surge techs and paying them while they train, and there's going to be a lot of people who want them, should we go back to a legal requirement? We're thinking about that now, but we haven't said yes to that. So it's a tough one. I do think retention is really important generally, and I'll share, as a hospital system, one of the things we're learning is for every 100 people who come in, 30 are leaving within a year. And that's a lot, right? And so I truly believe that if you're coming in through a structured training program, you're just coming into a better environment. People are expecting you, you know what to expect. You have a cohort of people you started with who are able to support you. You have teachers who you can talk to and things like that. And you will see better results. We are tracking retention. I don't have numbers to rattle off, but as we move forward, we know retention is a huge piece of the puzzle, and we need to track it and make the case that retention is better when you're creating a program that is supporting people, and kind of when you're building the talent, you've got better retention than buying the talent. So yeah, we are building out our capacity to track retention. Yes.
Good morning. Thanks for your presentation. A lot of what you're talking about is bringing people into new roles at the entry level. My organization does leadership development training across northern New England, and I'm curious what you're doing in the retention side around leadership development at your system.
It's a good question. That does not fall under me. So I think, what would I say? I think the MBA program is something that we're doing in terms of leadership retention. I think we have more work to do in that space, and we're starting with, we're starting to build out stuff, and some of the things we're starting with in the leadership development space are, how do we help you be a better leader to retain your employees in some ways? But yeah, I can't really speak to like what the big plan is there, but we talk, it's sort of, it's interesting, we've been a system for 5 years, but 4 of those years were during COVID, and it's just taking a while, so we're still building it out. But I think succession planning is something that's kind of hot on everybody's minds, and we see ourselves building towards something, but on the leadership side, we're just not fully baked there yet. Good morning.
You mentioned the bad old days when there was so much competition and lack of trust, and I grew up in Western Massachusetts, so I know the cultural divide between the hub and the rest of the state. So we've got the same thing going on in Maine, but in spades. So why is it that the hospital institutions, the healthcare institutions, and I said hospital on purpose, hospitals used to train nurses. Hospitals used to be the educational resource for the entire community. What do you think's happened in Massachusetts specifically, where there's lots of hospitals, but yet the nursing homes and the doctor's offices may be out in Pittsfield and in Ware? What's different, and what might work better? Where's the lesion that we haven't been able to staff those places with techs and nurses, but also primary care doctors?
Oh, that's a hefty question. I will say, and I think Maine is a little bit different, and you might be ahead of us here. I think in light of COVID and everything it laid bare, we need in Massachusetts to really say, what is our demand and what is our supply as a state? I don't think we have enough seats in nursing schools in Massachusetts, but we are slowly moving toward a result there. But in my mind, and this is one of the things I'm pushing for is with the state board, is we need to really get on, well, so how many nurses do we need, and how many do we need in Western Mass, and how many in Central Mass, and how many in Eastern Mass, and where are we growing them, and does that make sense? And because, and if you need them in Western Mass, then put a nursing school in Western Mass, right? And put those trainings in Western Mass. And I do think we could get there with local workforces that live there, because that's really who we ought to be relying on. But it takes a proactive planning that we have yet to do as a state. I think we've let this ecosystem kind of run itself for a long time, and now we're at a point, and with every challenge is an opportunity, but I do think with this challenge is an opportunity to really rethink, do we have the right educational and training infrastructure for our needs across the state? So I would think, and again, I'd love to hear from somebody in Maine. I do think you've got a better kind of big picture view maybe than we do. But if you don't, I think that's where I would start, and that's where I'm advocating that Massachusetts starts.
We take one more question. It's here.
Let me see if this, yeah.
Hi, thank you for your presentation. I just had a question around patient feedback and also to help with quality improvements, if you could talk about that practice.
Yeah, again, when you're part of a big system, people really specialize, and so there's like a team of people whose job it is to take the patient feedback and do quality improvement, and that is not my team. But So I think, I think any good training really talks about what it means to be working with patients and to be a good healthcare provider, right? And if you find people who really want to do this work and you train them right, then hopefully that leads to a better patient experience. And if you have people there, and if you don't have those seats filled, that leads to a worse patient experience. So how do you find the right people and the right quantity of people to move forward? That's how I think about it. And there's a whole other set of people thinking about that differently, but that's not my space.
All right, go for it. I don't know about this mic.
Good morning. Well, you just started to allude to the question, or I think what is the major issue here is the F word, forecasting. And I don't know that we have a great method of doing that here, but I do know that we definitely have Maine Gov has some data on healthcare positions and the need for those positions and the amount of vacancies in those positions. But I think forecasting and connecting that to the community college systems, the adult ed systems, that part is still not exactly transparent for everyone, and it's really fragmented. So that's somewhat, I think it would be great from a statewide perspective to have that as a solution for today. Like if I go walk away with, we're gonna do that in Maine, is come up with forecasting and how we could fix that. Fixing it would be my second favorite F word.
That's great. I'll share a story that we applied for a Department of Labor grant last year. We didn't get it, but our goal was to, train our own employees to become nurses at different hospitals. And then I was like, okay, who are we going to partner with as a community college? And I had to partner with a bunch of different community colleges because there were limits as to how quickly they could grow their nursing program. And then there were extra costs around growing your nursing program and extra fees and extra teachers. And I was like, oh my God, this is so hard to do, and yet this is exactly what we need to do. So forecasting is step number one that gets us all on the same page of like, what is our goal here? And then we have to get at, why is nursing considered a money loser at some community colleges? And how do we make it not a money loser, right? And what are all the issues that are stopping us from having the right number of training programs once we know what we should be doing? So I agree with you 100%.
That was a good call to what we could do here together. Okay, thank you very much.
Thank you.
Big round of applause for Joanne.
Thanks.
And I'm sure that in 10 years we'll be right where all the work in Massachusetts is. It'll never be fixed, says Joanne, but we are working toward it. So we have a 10-minute break. And when we come back, we are going to look forward to a moderated panel looking at some of the pipeline of the education and training system. So feel free to take 10 minutes. Come back if you could, right at 10 of. Thank you. Okay, whoa. Well, that woke everybody up. Okay, folks, come back together. Let's come back together. Joanne. Joanne, is this yours? No, it's mine. Oh, it's Joyce. Let's come back together. Yours. Thank you.
All right. Well, thank you all. I am Joy Gould, Director of Healthcare Workforce Development at DHHS, and I am so excited to introduce our amazing panel of education and system partners. So I'd like to introduce Chancellor Malloy, and I'll read a quick bio. The full bio of everyone is in your packets, but some of the highlight reels. Chancellor Malloy became Chancellor at the University of Maine system in 2019. Under his leadership, the system successfully navigated a global pandemic, increased the number of high school students annually earning free university credit by 32%, expanded high-quality online education, dramatically decreased student borrowing, grew graduate enrollment by 22%, and launched innovative adult degree completion initiatives to meet state workforce needs. Chancellor Malloy has helped the University of Maine system secure a $240 million grant from the Harold Alfond Foundation to advance student success, graduate and professional programs, and Division I athletics. That grant has since been supplemented by an additional $80 million commitment. Prior to his appointment, Chancellor Malloy was a public servant for more than 2 decades, serving as a prosecutor, mayor, and 2-term governor of Connecticut. He was also honored as the 2016 John F. Kennedy Profile in Courage Award recipient. So thank you. We have Dr. Betsy Libby in red. Betsy Libby was appointed president of Central Maine Community College in 2020. Since 2006, Dr. Libby held a variety of leadership positions at Central Maine Community College, including Director of Admissions, Dean of Student Services, Dean of Academic Affairs, and Vice President. Prior to returning to Maine, she worked for the State University of New York system. Dr. Libby grew up in Maine and as a first-generation college student. She also earned her bachelor's degree from the University of Maine and is a doctoral degree in higher education leadership from North Central University, where she focused on institutional effectiveness. Sitting next to Dr. Libby, we have John Mason, who is the Chief Strategy Officer for Jobs for Maine Graduates. John joined JMG as Chief Strategy Officer in 2022. In this role, he is responsible for overseeing the expansion of JMG's workforce development operations, execution of major program initiatives, including the Maine Career Exploration, and assisting the executive leadership of JMG with long-term organizational strategy. Previously, he spent nearly 20 years at General Dynamics and Bath Iron Works in a variety of roles in human resources and finance. This culminated in his role as Vice President of Human Resources, with responsibility for the strategic leadership of a team of over 200 human resource personnel in support of more than 7,000 employees. John holds an MBA from Boston University and a BA in Financial Economics from the University of Maine. Sitting next to John, we have Tamara Ranger, otherwise known as Tammy, who is the Director of Workforce Development and Innovative Pathways at the Maine Department of Education. The Workforce Development and Innovative Pathways team is comprised of adult education, career and technical education, extended learning opportunities, and education pathways and early college. The team's focus is on expanding learning opportunities for students and supporting Maine's workforce goals. Previously, Tammy led the Educator Excellence team, supporting educator recruitment, retention, and recognition. Tammy is also a National Board Certified Teacher, and in 2017, served as Maine's Teacher of the Year. Next to Tammy, we have Jolene Luce, who is the Director of the Western Maine Area Health Education Center, which is in collaboration with Maine Health. Jolene has over 10 years of hospital experience with a passion of connecting education to healthcare. Her background is in English education, arts, and healthcare administration. She's completing her master's in healthcare administration at St. Joseph's College in Maine. And throughout her career, she's worked within various educational and administrative roles. She also is one of the faculty at a couple of the adult education programs, so she comes at this from multiple perspectives, and she's from Starks, Maine. Sitting next to Jolene, we have Samantha Diner, Associate Commissioner of the Maine Department of Labor, and has been an excellent partner and collaborator in all things healthcare workforce. Samantha leads interagency workforce collaborations, advises on workforce policy, and oversees the deployment of Maine jobs and recovery programs for the Maine Department of Labor. Her recent areas of focus include overseeing cross-agency coordination of healthcare workforce initiatives, leveraging federal infrastructure funds to strengthen the public workforce system, sustaining American Rescue Plan Act investments, and expanding apprenticeship and pre-apprenticeship opportunities. Prior to working for the state of Maine, Samantha led strategy development for community foundations, collective impact initiatives, and corporate social impact programs at a social impact consulting firm. So we are so thankful to have these amazing panelists here. If you would welcome them with a round of applause. That would be great. And I will start with Chancellor Malloy. If you would just give a quick intro about your organizational role in workforce development, and then when it comes to healthcare workforce development, what opportunities are you most excited about?
It's great to be with all of you, and thank you for the opportunity to be a presenter as well. A little bit, you all know a little bit about the system. We consist of a number of our universities, all called University of Maine, with the exception of University of Southern Maine. Here's a statistic for you. Between 2018 and 2023, our system conferred nearly 30,000 degrees or certificates as well, and 4,501 of those were in the health area, and the largest number being in nursing, where we have programs at the University of Maine, University of Southern Maine, University of Maine, Augusta, with a cohort based also at Farmington and UMFK. So we are big in this area. We're supportive and understand the needs that Maine has and quite frankly is struggling to meet. And we want to be part of that solution. That probably means that we have to change our approach to you all, that we've got to be a better partner, that we've got to be reaching out more regularly to understand the challenges that you need our help or want us to be involved in. And I can assure you that the system as described has changed quite a bit in the last few years. We probably have not done as much as we need to do with you folks. And so we really do want to have an ongoing discussion about that. One of the other things that worries me, however, of that 4,501 individuals who we granted degrees or certificates to, 86% were women. I'm not upset about 86% being women, but what I'm worried about are we missing opportunities to re-educate a younger population that is looking for high-paying jobs, nursing being one of those now. By the way, my mother graduated from nursing school 90 years ago and also formed a union of nurses as well. I think that we need to spend some additional time educating the population, say from 8th grade through high school graduation, about the real opportunities that healthcare represents to the broader community and the need that needs to be met. And one other area where I think we're letting folks down, of that 4,501, only 4% of those individuals had a military background. We've got to reach out to that audience of people as well and make it easier to convert great training, great experience, great discipline to a field that needs all of those things and more. So we've got to build bridges to that community. We're looking for partners to help us help you, and feel free to reach out at any time.
Great, thank you. So Dr. Libby, if you could just tell us a little bit about your role at Central Maine Community College and what you are looking at in terms of healthcare workforce development, as well as any opportunities that you're most excited about.
Okay, thank you. So I'm the president at Central Maine Community College, which in this arena really means that I can seek out funding for other people's really good ideas. We have brilliant faculty and workforce development staff who are in tune. They come to me, they have ideas, they're approached by partners, and then I help them reach those goals. I'm here today to represent the entire Maine Community College system, so I'll try my best to do that. The thing I'm most excited about is just the increase in trainings that we've been able to provide. Through the Maine Jobs and Recovery Plan funding, we've been able to create as a system 3,500 seats in short-term healthcare trainings. Those will run through the end of June 2025, and so far over 2,100 of those seats have been utilized. The other thing that I'm really excited about is when we increase these number of healthcare trainings, we're also increasing pathways and ladder credentials, and it's pretty awesome that I'm sitting between these two gentlemen today, because we've started a new program with JMG where they're helping high school students reach their aspirations, and those students are coming to us in the summer for some programming in healthcare. They'll stay with us, usually, hopefully, for their associate's degree. We'll be able to bring in as credit the prior learning assessment that they learned in high school. They graduate with us, and then they move on to my partner to the right. So just laddering the credentials, getting people the credit credit for the information they know, and shortening the length to a credential is one of my greatest opportunities that I'm excited about. Our industry partner relationships are expanding. The two I just mentioned, I'll talk about one later, happening with Northern Light and Maine Health. But even with those huge, large hospital organizations, we're doing a lot of work with the smaller hospitals. We have some new work in CNA training and medical assisting with our local adult eds, so that's been very exciting. Yeah.
Great, thank you. So John, for those who are not familiar with JMG, could you give just a quick overview of the program and the specific slant on health workforce?
Sure, absolutely. Good morning, everybody. It's a pleasure to be here. And Dr. Libby, you did such a nice job talking about what we're doing. I'm not sure I need to add too much more, so thank you for that. But for those of you in the room that aren't familiar with JMG, we are the state's largest educational nonprofit. We were established by the legislature in 1993 as a dropout prevention and education to career transition service. And since that time, over the last 31 years, we have expanded out so that at this point we're now offering our services in all 16 counties of Maine, and we have programs in almost 90% of Maine's public school districts, along with all of Maine's public colleges and universities. And what we seek to do is we offer a continuum of support beginning as early as middle school and continuing through high school and into the post-secondary environment to assure that all Maine students graduate, attain credentials of value, and move on to meaningful careers with Maine employers and a productive adulthood. So in that work, we work with a lot of the partners and my friends that I have here on the panel today. But to be directly responsive to your question, Joy, in terms of the things that we're excited about, I wanted to embarrass my two friends to my right here. So first of all, if there was something I was going to bring up on this front, it would first be the Harold Alphonse Center for the Advancement of Maine's Workforce that's offered by the Maine Community College system, and the work they're doing offering short-term workforce trainings. That's really become a valuable addition to the list of options for our students as they proceed out of high school and evaluate what they're going to do in the post-secondary environment. For some students, they're ready to go and they want to lock right in with a formal degree program, and that's great. For some other students, they want to move directly towards a form of employment or the military. But then there's also a group that's not quite sure, and the ability to now offer through the center these short-term workforce trainings that are completely free of charge, and in a matter of weeks upskill these students to the point where they now can get a job that very frequently then offers ongoing education supports from the employer so that they can continue both with the community college system and the University of Maine system has really been a game changer. And I bring that up because there's a variety of both healthcare, directly clinical related trainings that are available, and then also many other options that are beneficial to Maine's health systems as well. The examples I'd bring up would be CNA, phlebotomy, patient service representative, but I always feel like stories do a better job than sometimes just rattling through data and through lists of available options. And there's a story I like associated with the short-term workforce trainings that I wanted to share briefly. Dr. Libby mentioned the summer programming that we've offered for our students that gets them into these workforce trainings. And what we did last summer was we identified for our students that were graduating high school but didn't have their plans set yet. They hadn't decided, I'm going to go to school or I have this job. We offered some programming, as Dr. Libby mentioned, where for a few weeks in the summer they could come on board, do the workforce training, stay on campus, get room and board, and this was all covered through a combination of funding from the MJRP and the Harold Alfond Association, and also some of the ARP funds that were flowed into the state. And I wanted to briefly tell you the story of 5 students that did the CNA course at SMCC when we offered this. So they went through, and in a matter of 4 weeks, they completed their CNA curriculum and ended up getting pinned. And while they were doing that process, they did their clinicals at the Cedars Retirement Community in Portland. At their pinning ceremony, the Cedars arrived and made them all job offers upon completion. So if you think about it through the lens of a student who graduated high school without any real plan and started going into their summer not sure what the next step was going to be, fast forward a couple months later, gainfully employed with the Cedars, and I remember one student in particular, I was talking to her, and she said, no, my next plan is I'm going to enroll at USM, and I'm going to start working my way towards getting a degree, and then work towards med school, and I'm going to be a doctor someday. So for a student to transition, yes, thank you, yes. Yeah. For a student to make that much transition in such a short amount of time is just really exciting. So I'd be remiss if I didn't call that out, and then I'm taking longer than I should here. But the other piece I would like to call out that we're really excited about is what the University of Maine system is doing with their research learning experiences. So this is exciting, and as a black bear myself, I love seeing stuff like this. But these RLEs, which are part of what the University of Maine system is doing with their Transforms initiative, is funded by the Harold Alfond Foundation, and it comes in 2 parts. So when a new black bear is going to be heading onto campus to start their pursuit of their degree, they first participate in an immersive experience to get their hands into a certain topic, and then in a cohort basis, they then move forward and do a small project in their first semester at the University of Maine. And I bring this up because the topics, which have really cool names, include things like thrive as a nursing student, or hunt for the virus, or even things that aren't directly clinical, but also very beneficial to our health systems, things like designing new computer interfaces, playing with electricity, or working on real-world business problems. We're really excited about this for 2 reasons. First of all, from a student standpoint, it provides a really nice, smooth on-ramp to transitioning into that full-blown college life, which is a big transition for a kid. But then on top of that, offering the experiential and cohort-based learning, too, just appeals to so many of our students. So really excited about both of those.
Thank you. And Tamara, could you tell us a little bit about your role at the Department of Education and the kind of backing the pathways up from the K-12 model?
Sure, thank you. Can you hear me? Okay. Good morning, everyone. Thank you, Joy, and hello to my fellow panelists here. My name is Tammy Ranger, and I'm the Director of Workforce Development and Innovative Pathways at the Maine Department of Education. The Maine Department of Education is completely committed to supporting Maine's workforce goals, which of course would include healthcare workforce development as well. And to that end, in 2022, Commissioner Macon, the Commissioner of Education, she created the Office of Workforce Development and Innovative Pathways, which Joy explained in the beginning. Our office is comprised of 4 teams: adult education, career and technical education, early college and education pathways, and extended learning opportunities. And our office has 2 major goals. One is to create engaging and meaningful, relevant learning opportunities for students and to expand as many of those as possible, and also to elevate our collective support, the 4 teams' collective support for Maine's workforce goals. In 2023, the Office of Workforce Development served over 30,000 learners, and in conjunction with many of the partners seated here at the table with me, had a significant positive impact on Maine's healthcare industry. I'm very excited about the collective impact of our teams, and I want to share a little bit about the work that they've been doing. So adult education, under the leadership of Megan Dichter, has more than doubled the number of healthcare credentials earned, from 933 credentials in 2022 to just under 2,000 credentials in 2023, with the most growth seen in CNA and behavioral health professional certifications. CTE, under the leadership of Dwight Littlefield, their enrollment is at an all-time high, with over 10,000 students enrolled in career and technical education programs. So while the highest enrollment in healthcare-related programs was prior to the pandemic, enrollment in these programs has been on steadily climbing, with an increase from 892 enrollments in 2023 to 971 enrollments in healthcare industries in 2024. The highest enrollments are in nursing assistant, EMT, and allied health services. Chancellor Malloy talked about getting more young men interested into the healthcare profession, and I can share some data about that. We are seeing a positive increase in that, with that demographic. In 2018, we had 110 students who identified as male enrolled in the health programs through career and technical education, and that number increased to 164 in 2024. So we're seeing an upward trend there. Under the leadership of Dr. Jason Libby, our early college programs continue to support high school students entering the health professions through our Aspirations program and early college grant programming. The ability to earn college credits towards certificates or degree programs in nursing, EMT, or other allied health services is an important opportunity, certainly for all students, but mostly for those students who are facing economic disadvantages. A new one that might sound, our team, our extended learning team might be something new for you. It's called Extended Learning Opportunities. And I know when I was first introduced to ELOs, I'm dating myself here, but all I thought about was the band, the Electric Light Orchestra. This is not what we're talking about. So extended learning opportunities are real-world learning experiences outside of the traditional classroom. Community-based, experiential can be offered for credit or sometimes without credit. They can include job shadows, paid internships, unpaid internships, guest speakers. So you think about if a student is going into a career and technical education program, they're committing to a 2-year program, 350 hours. The beauty of extended learning opportunities is they're very, very flexible. They could be a half of a semester. They're really very much student-driven. And so a student gets to test out, I think I might be interested in being a lawyer. Let me experiment with that a little bit. And they can test it out and see if that's a career path that they want to follow. So extended learning opportunities have been very, very powerful in helping students identify career aspirations and if they want to continue down that path. The Extended Learning Opportunities program in our department has been under the leadership of Rick Wilson, and that just recently transitioned to Lana Sawyer. And the ELO program at the department is under the bigger career exploration programming from the Department of Economic and Community Development, funded by the Maine Jobs and Recovery Program. And we work very, very closely with Jobs for Maine's graduates, JMG, on extended learning opportunities. We've served over 1,000 students in 2022 with ELO programming, and many of those students, of course, explored career paths in the healthcare industry. Something that we're very excited about, we're excited about a lot of things. I'm thinking right now of adult education's integrated education training. So this is training where students are receiving industry sector training and also English language learning concurrently. And so thinking about healthcare, it would be learning healthcare vocabulary, reading technical texts in English, and also writing incident reports in English. And I know many of you and my partners here that were involved in this. Just a couple of weeks ago, Lewiston Adult Education graduated 14 students, all multilingual learners in the CNA Healthcare Pathways program, and 6 of them are already employed in the healthcare industry. And so that's a really, really promising practice that we're excited about. Thank you.
Thank you. Jolene, I don't know that everyone across the room is familiar with what the area health education centers do. So if you could give us a little overview.
So the Area Health Education Center, AHEC, we are actually a network across the United States with over 300 program offices. Maine's program office resides within the UNE, Center for Excellence in Public Health. We work closely with Maine's 3 regional AHEC centers. So I myself am the director for Western Maine. That is Somerset, Androscoggin, Oxford, and Franklin counties. A little bit of Northern Kennebec thrown in there as well too. And I actually grew up in Somerset County, so to be in this type of position, working with this type of efforts is very, very near and dear to me. But we're committed to enhancing health equity, reducing disparities among underserved populations through team, community-based programs that we get to offer. So a lot of my friends up here, actually, we work daily with one another. So things like their ELO programs and JMG and their students, they're coming to programs that AHEC is sponsoring and putting on and designing and providing the footprint for. So it's been amazing to be part of that. And really just any experiential education and strategic partnership, that's really the goal. So that's a little bit about what AHEC is. And what I'm super excited about is we are HRSA funded as well. It's one of our 3-prong funders. But we are now, there's sort of this new energy around focus area. And so our learners it used to be a smaller pocket of focus area, maybe for your high school into an adult learner. But now we're able to look at, junior high students and extending those age groups of where we can offer programs and increase partnership. And I think by expanding that, we just give more opportunity now. And also, the adult learners sort of in a more non-traditional platform of now we have tangible resources we can focus on providing to those learners who are maybe have been in sort of any type of recovery program that is related to a social determinant of health. So being allowed to look at that expansion, actually allowed, but being supported to look at that with the funding behind that, that's a great thing. So partners at this table, along with sort of that federal trickle down, has really been monumental sort of in the scope for this past year and really into the next 5 years of focus as well. So great, thank you.
All right. Hi, I'm Samantha Dyna. I'm at the Maine Department of Labor, and the Maine Department of Labor does a lot of things, but I'm going to talk about 2 roles that we play within the healthcare workforce. So one is we really see ourselves as a workforce system convener, and so how we did that over the last couple of years was we worked really closely with all of these partners and many of you to develop healthcare training for me, which was a joint initiative with University of Maine System, Maine Community College System, Department of Health and Human Services, and Department of Education. And so we really worked to convene all of these partners to look at how do we serve employers' needs and really understand what are the top occupations that you need to fill, and create a central landing page with all of the healthcare training opportunities across the state and help identify where there might be gaps through a central intake form. So I'll talk a little bit more about that, but that's one role that we play in the system. The other role that we play at Maine Department of Labor is really supporting job seekers and getting connected to jobs. And so we did that specifically through healthcare workforce with the development of healthcare sector navigators. So throughout Maine Department of Labor, we have 12 local career centers, a number of workforce partners as well that are delivering services locally on the ground. And last year, we delivered services virtually and in person to over 30,000 individuals. The healthcare sector navigator is sector specific, deployed within the career centers who have healthcare expertise to really help job seekers figure out how they might connect to a healthcare career pathway, what training opportunities might make the most sense, what support services they might need, childcare, transportation to get to and stay in those jobs. And so we, over the last 2 years of piloting that approach, were able to serve almost 500 job seekers connecting to healthcare specific training opportunities, job opportunities, and support services.
Sam, I'm going to actually ask you to keep that microphone in your hand because we're going to, in the interest of time, combine a couple of different questions. But one of the things that I'm so excited about is all the collaboration that is represented at this table. So Sam, could you speak to just a couple of the new approaches and partnerships you were able to pilot with some of the resources from the Maine Jobs and Recovery Plan program?
Sure. So I'll talk a little bit about pre-apprenticeship programs and apprenticeship programs. So Tammy already gave a little preview of one of the Lewiston Adult Ed programs that talked to about 14 folks and really helped them build not only soft skills, so work readiness skills, English language learners, I think they were all new Mainers, and technical skills. So pre-apprenticeship combines all 3 of those pieces, soft skills, technical skills, and industry recognized credential, sometimes English language learning as well, and builds a pathway to a career pathway. So that connects directly to a registered apprenticeship opportunity, which is a job. And so we were able to pilot career apprenticeships during the last couple of years, thanks in part to Maine Jobs and Recovery Plan programs. And in the last 2 years, we've been able to create over 30 pre-apprenticeship programs to serve over 500 Mainers, and 100 of those are in healthcare occupations. So we've been really excited about that opportunity to expand the on-ramp program. People get exposure to a career, but they walk away with a clear pathway to the next step. The other piece that I'll talk about, I'm going to go a little bit deeper on healthcare training for me just because I'm super excited about it. The centralized location is one website. It's healthcaretrainingforme.maine.gov, but I think you can just Google healthcare training for me. And we have been able to serve over 177 healthcare employers through this landing page and over 4,000 new and incumbent healthcare workers. So right now, we hear from employers, it's hard to figure out which resource is most appropriate for me and my staff. I don't know exactly where to go. This is where you can go. So you can go right now, healthcare training for me. Just tell us what training you're looking for. What does your workforce need to upskill? And we'll do the background work. So we'll work behind the scenes with our partners at Maine Community College System, University of Maine, Adult Education, and help you do that navigating so you don't need to figure out which program will best serve your needs. The most exciting part about this is it has staying power. So we launched it 2.5 years ago, and we've had over 37,000 website visitors, and just in the last 3 months, 4,000 website visitors. So people are finding it, they're getting connected to training opportunities, and it's a really good model that we're excited to pilot to other sectors.
Great, thank you so much. I will also put in a tag in that includes everything from frontline short-term credentials on to the degree programs, as well as employer-sponsored training programs. So if you are running some in-house training and you want those added to healthcare training for me, please do reach out. There are so many wonderful initiatives underway. We've got a lot of healthcare employers in the room, and we threw a lot of data at you all. But I think what we would like to know from your perspective before we open it up to the audience, and I'll start with you, Chancellor. What is one thing that you really want health sector employers to know about the work?
Well, you know, we're putting a lot of effort into becoming a better partner. Here we are in this building. The nursing program from UMA is in the back of the building. In the last 5 years, that program has grown from 50 students to 320 students. And when it moves into its new home across the road, the old Purdue University site will actually expand to 400 students at that time. And there are similar stories to tell throughout our system. We recognize the danger that Maine's in because of the lack of the folks that we need to take care of one another. And we're doing everything we can to step up those efforts, including, by the way, finding additional resources. So $750,000 in student support and infrastructure to increase the number of trained medical laboratory folks. And that's at UMPI and University of Maine. $800,000 in new immersive simulation center up at Fort Kent. And I think you'll be hearing from Kelly later today on that. On the mental health side, $285,000 was identified to increase services in the mental health area as well. Again, our story today that we want to share with you is that we are going out. We're on the road. We're meeting with the heads of the various systems throughout the state. And if we're not doing something that you need done, and you want a partner to move us in that direction, we are open for partnerships. And I want to stress that to the greatest extent possible. If we're not meeting your needs, tell us we're not meeting your needs, and then tell us how we can help.
Thank you. All right, so the one thing I want to leave you with, I guess I would say that the Maine Community College System is very focused and dedicated to meeting students where they're at. And everyone's at a different spot. So we might have a student in a short-term MJRP workforce training that we are able to provide a learn while you earn opportunity. So they're still earning money while they're having this free opportunity for training. The opportunity is free for training, but there are still bills to pay and children to feed. And so we can find ways to help students earn an income while they're receiving the training, either during their work or for an attendance stipend. Then we have students who are in our degree programs who are at a different spot, maybe brought in some credit from that, or starting fresh, or in a retraining program. And we're able to provide them opportunities for on-the-job training, credit for work. We have student navigators that can help people really hold their hand with what they might not know. It might not have anything to do with school. How do I get to school? Those kinds of things. I would also want to leave you with a new partnership that started. It's in the end of its second year. So the nursing expansion work through the Maine Community College system and Northern Light and Maine Health has allowed the Maine Community College system to expand our nursing seats across the 7 campuses. There are nursing seats available at the Maine Community College system. There was a time when there weren't. But at Central Maine Community College, we added a spring program which brings in 40 new students annually. At York County Community College, they admitted students every other year after the 1 year had been taught out. Now they admit students every year. That's 32 new seats. And really, really proud that Washington County and Calais, who has not had a nursing program, was able to fall under the umbrella of Eastern Maine's accreditation to start one, and they have sought and secured their own accreditation, will have a standalone program. So the funding that we secured from our hospital organizations and a state appropriation has doubled the number of nursing seats in the Maine Community College system since 2022. So if you have any questions about that, ask me. We'll be over at the table over there. So we're excited about those things, but just really meeting students where they're at would be the message that I would have you leave with.
Okay, so one thing to wrap it all up here. I'll do my best. So I gave the introduction on who we are at JMG and what we do, but if I could leave you with anything here, it would be that at the end of the day, we're working with over 12,000 Maine students every single day from all 16 counties in the state. And if we think about it through that lens, we take very seriously our role in contributing to the workforce development strategies of this state. And I really like the way our keynote speaker put it when she talked about building talent versus buying talent. And we find ourselves firmly in the position of working to help build the talent here in the state. And it makes me think of what the 10-year economic development plan from DECD talks about in that need to add 75,000 jobs to the state. There's 2 ways you can do it. You can in-migrate talent, or you can build your existing population and upskill your population to deliver on what the state needs economically. So seeing our role in that latter piece is what we take very seriously. And then I throw a bone out to Nate Wiles at Live and Work in Maine. He's got a really innovative strategy on the other piece in terms of really promoting Maine as both a place to work but also a place to live. And they do a really nice job over there. But we're uniquely positioned to work with the future workforce of this state by what we're doing and the places where we operate our programming. The other thing that I would just make sure is clear as I wrap this up would be most of the students that we serve are economically disadvantaged, and the majority of our programming is actually operating in some of the most underserved and rural parts of the state. So a lot of what we're doing is ensuring that we create a level of equity of access and opportunity for those students. A great example would be Tammy was talking about extended learning opportunities, which we're proud to partner with them on that work. If you put yourself in the position of a student and compare, say, a student at Portland High School to a student at Fort Fairfield High School. At Portland High School, these aren't precise numbers, but they'll be representative. At Portland High School, a student may have access to a couple dozen different elective options that they can use as they go through their high school career. For Fairfield, they may have a handful by comparison. So if you take ELO, that can be a real game changer in terms of leveling the field and offering alternatives to create that equity of opportunity and access. So we take very seriously our role in that.
Thank you.
So something that I would like to share that you may not be aware of, can you raise your hand if you know what the New Mainer Resource Center is? It's about half and half. So the New Mainer Resource Center has been located in Portland Adult Education for a number of years, and they have three primary functions. One is to advise on career advancement, and another is credential evaluation and support with licensure, and then support for employers to provide training for asylum seekers, refugees, and the immigrant population. So very, very excited to share that the New Mainer Resource Center is expanding to Lewiston Adult Education and Bangor Adult Education. So getting more into Central Maine and Northern Maine, servicing those areas. And so I wasn't sure if you were aware of that. I wanted to make sure you knew about that. Lewiston is open and Bangor should be opening soon. And the Department of Education is very, very committed to developing the next generation of workers. We have an open door policy. If you have ideas that we're not thinking of, please reach out to us. We are even being more intentional with starting with younger and younger grades. We currently have an RFA, a request for applications out for career exploration for students in grades 4 through 6. So really getting kids at a young age, just trying to think about what are the opportunities and letting them try out things. So we have an open door policy. We'd love to hear your ideas. And I also very excited. I think you could hear a lot of overlap. Sam talked about the healthcare training for me. That was on my list. And I think it just speaks to Maine and the strong collaboration between all these partners. Thank you.
So with Maine AHEC, there was a real focus on, of course, the University of New England, and we had all of these students cross disciplines within healthcare fields coming to school in Maine and then going home, right? Not staying in Maine necessarily, going back to practice at home. So how can we approach that? So Maine AHEC Collaborative came together as a team and said, okay, well, let's do a project called the Rural Health Immersion. And so we want to showcase Maine to these students. They're going to school here, but they're not really seeing much else in terms of opportunity here after they finish school and bridge on to their workforce, their career. And so Rural Health Immersion, what we have done is each center houses anywhere from 5 to 15 students per group, and these students come and live with us in rural Maine settings. And these are young, soon-to-be doctors, physical therapists, et cetera, and they're working here for about a week, and they're living here with us. And what that has shown them is there is increased opportunity here. There is viable networking and the chance to enhance their career and develop and do well in a rural setting, in rural healthcare. And what has come from that recently, which I'm really excited about now having seen this happen over the past couple of years, is those students are now coming back to do their clinical rotations here. And they're now doing their residency programs here. And they're now staying in Maine just because they got the opportunity to see it. And I say that because it also lends into our younger student demographic with ELO programs and JMG programs where John and his team, Rachel, will call me up and say, I have all of these students in. What am I going to do? Where am I going to put them? What type of programs do you have in your areas that we could utilize? And so things like Scrub Club, which is a multi-day student exploration program. These students from 8th grade, 7th grade are now coming in and getting to do hands-on education within a healthcare field that relates to them. And it's giving them this encouragement and this confidence that they can go into healthcare and they can be a doctor. They can do these things. They can be a nurse. And we're seeing that really happen and take shape now. So our Scrub Club has been long-standing for over a decade now at Franklin Memorial, and we have been able to foster that program within other Maine Health facilities and with our JMG cohorts to provide that not just in our area, but in the Portland area as well, and do a collaboration with the New Mainers Public Health Initiative, and to really encourage these students to explore healthcare in a fun way that's not so intimidating, because that can be very scary for a learner. We have a lot of young learners that say, oh, I want to be a nurse, but it's so scary to go into nursing school or to study for my HESI and to do that. And we're giving them the confidence to start with that they can do those types of things with these types of fun programs, because it makes it fun for them. It makes it something that they want to go do, and it really increases that for them. So it's been a real team focus. I've also gotten to work a lot with Maine Health in the initiatives around, of course, we've talked about it multiple times up here, but developing and growing our own within our systems, right? there's our opportunity. We have people who already work for us, who have shown dedication to us. Where is their opportunity? And so really have seen Maine Health, along with a lot of other partners, take that initiative, and with cohort partners such as AHAC saying, okay, let's put together an apprenticeship. So now we're doing CNA apprenticeships. So they get to be paid while they learn and go, and then they can manage life and school, and they have the support and the infrastructure to do that. We also see that with our medical assisting program as well. So that's a really great collaboration through the adult ed programs, AHEC and Maine Health, to not only give them the support and the funding to do that, but the clinical placement availability to be able to do that. So I could go on and on and on, but we'll stop there.
Jolene, you totally helped you made my job much easier because I had two and I know I'm only allowed to say one. So Jolene hit on registered apprenticeship, which I want healthcare sector employers to know it is a job and it is not just for traditional trades. So please talk to Joan Dolan or go to her session to learn about how registered apprenticeship can lead to a 91% retention rate with your workers. I've heard a lot about growing your own talent and retaining your talent, and healthcare registered apprenticeship is one very effective model, and we've had some new occupations like medical technologist pop up in the last couple of months. So we're really excited. Only 25 healthcare employers, I think, are current apprenticeship sponsors or sub-sponsors. So I'm excited about room to grow that really effective model to meet all of your retention and upskilling opportunities.
Great, thank you. And we'll have working lunch so people can ask questions if you don't get to ask today. We want a lot of interactive and engagement, but wanted to open it up to the audience if there are questions for anybody on the panel.
It was great really seeing all of you up there. I have a question if either at Department of Education or if there's been consideration, because we're talking about earn while you learn, and one of the important aspects that did not come up is besides earning money, people often, learners whom I've seen, come in really needing healthcare insurance. And so by providing an earn while you learn or a position, we're actually providing them health insurance. And so I was just curious, are there any further collaborations with health insurance companies that perhaps people who are in an educational role, maybe US Health or Aetna or one of them, would be sponsoring these types of programs in our state?
Seeing no answers from the panel, I know that access to care and healthcare is a key priority for Commissioner Lambrew, and so there is the healthcare marketplace. But Michael, you bring up a really great question, and we will take that back. That's something to consider. Thank you.
Sure. Good morning. It's been fun listening to this. I work at Maine Health Access Foundation, and we do fund some workforce activities. And our senior program officer, Charles Dwyer, I'm going to call out so he can wave to the room, because he is the guru for us on this work. One thing that I was sitting here thinking this morning, listening to everybody, is one of our biggest population groups looks a lot like me. Healthy, active, 60-plus people who are looking for things to do between ages 60 and 75, maybe. And I think in health care, we often think of this population as people to be served. How are we going to deal with the giant wave of older people? I think we also should be thinking about this group, my group, as people who might be looking for different, more hands-on, and potentially part-time employment. And I think it's a real twist on how we think about healthcare careers, but how cool would it be to, start tracking 60-plus farm techs into the workforce? How amazing could it be to have a whole swath of MAs out there with deep life experience who are interacting with patients as they're coming into the system and have that empathy and experience to be able to really draw out the kinds of issues that their providers need to know. So I put that out as a challenge. We had the pipeline challenge, or the how many do we need challenge earlier. I think this is another challenge. How do we think about older workers in Maine who need a different framework for work. Maybe it's not full-time. Maybe they need different education. But I bet there are a lot of people out there who would be interested.
Yeah, I'll jump in on that one. It's a great point, and we are super excited about re-engaging older workers in the workforce. We have currently a public service campaign through the radio station in Portland that every month is putting out opportunities to connect older workers back into the workforce and thinking about more part-time flexible opportunities. And in the next couple of months, we're actually partnering with DHHS on an A4TD CSEP program, which is really directed at connecting older adults back into the workforce. The other piece I would say is we're really hearing from older workers that they're looking for something more flexible, so would really encourage employers to think about how to have opportunities that might be traditionally full-time, more part-time. Just anecdotally, we posted a job at the Department of Labor and made it part-time and saw double the amount of applicants. So folks are looking for flexibility. We're also, with our healthcare sector navigators, have seen some really great success. And with the Caring for Me campaign, one of the poster children of the campaign was named Carmen. And she was an older adult in Lincoln County who was providing support to an older adult in her family, and went to a local event, learned about the opportunity to become a direct support worker. She already had so much of the training and skills because she was doing this in her life, taking care of an older parent, and then was able to do that for other folks in her community. So would totally double down on that. The last piece that I'll say too is not just older workers who aren't yet connected to healthcare, but those that are looking for something more flexible as they're changing their lifestyle, and really thinking about how those workers can support mentorship in clinical rotations or instructional capacity. It's something that we're running into as we're looking at building the workforce of who's going to provide that instruction. We've got demand, we've got some wait lists, but we need instructors or we need clinical rotation mentors. So thinking about how we re-engage older workers to have something maybe more flexible to teach that next generation.
Thank you. This collaboration is very heartening, and thank you for what you're doing, and continue with that. I have a point to make and a question to ask you. The point I want to make is that there are thousands of people, very competent people with disabilities, intellectual disabilities, people on the autism spectrum, and other people with disabilities who aren't working, who want to work. So I would encourage all of you, as you think about programs to educate people, that you consider programs for people with disabilities. The other thing that I want to mention to you is I'm the interim executive director of the Maine Disability Oversight and Advisory Board. It's a kind of a quasi-governmental entity that provides some advice and so forth to primarily the Department of Health and Human Services. And one of the tremendous emerging crises for people with intellectual disabilities, particularly those who need IV sedation, is the lack of dentistry. We have adults in this state whose teeth are being taken out because they are so rotten, because they can't get the type of IV sedation they need. There are hundreds of people on dental waiting lists. It's causing behavioral challenges, which again is a big expense to the people with those challenges as well as the people who support them. So I haven't heard anyone talk. I've heard about doctors, I've heard about nurses, I've heard about CNAs. I've not heard a word about dentists. And I wonder what you might have to say about dentists, or the lack thereof.
Sure, I'll take that one from the DHHS side. That is definitely a key priority. Commissioner Lambrew is working on that actively, and in fact, with one of our partnerships, we have opened up different courses for expanded function dental assistant. Nicole will be here later on this afternoon. She can talk a little bit more about looking at how to expand dentistry across the community. So that is definitely a priority. And when we think about healthcare, I also want to frame it in the context of we're thinking about that holistically. So that includes our behavioral health providers, that includes our long-term care providers, emergency medicine. We have some really great examples of collaborations even from in the incarceration system and how to get people on those pipelines. So we're not looking at just doctors and nurses. I think that's the easy thing to point to because there's been so much fantastic work happening on expanding those, but we're also expanding social work positions and Masters of Social Work programs. And Chancellor, you've got some thoughts on that.
Yeah, well, one of the things I was going to say is that we have lots of shortages in Maine, and one is social work. And other states that don't have as big a shortage as we have are obviously integrating social work with the medical systems and coming out with pretty good results. So we want to step that up. One of the other things I would say to you is the University of Maine, Augusta has a very successful dental program based in Bangor. And a lot of that work is around free work given to the community, seniors. So we should probably we should probably get together and have a quick conversation, and I potentially could turn you over to some folks who might be helpful in that regard. One other thing I want to say is that only 1% of nurses in the state of, actually less than 1% of nurses in the state of Maine have a doctoral degree. We do offer a doctoral degree will be opening a PhD, I should say, at the University of Maine this year. We have a Doctor of Nursing Practice as well at the University of Southern Maine, and starting this year also at Fort Kent. I say that because one of our stretches here is the lack of talent, certified talent with appropriate degrees to aid in the training processes that are required. So if you want to teach a master's course, you have to have a PhD. One of the reasons we don't have anywhere near the number of masters that we would like, and by the way, have difficulty getting faculty, is that shortage. We are responding to that shortage very actively. And again, it goes back to what I was talking about. You want a partnership, we have free service. You want a partnership, we're offering new degrees that we hadn't offered and in the attempt to help close this gap.
Yes, I'm so glad you asked that because we weren't able to answer all of our questions today, and that was one of mine. So because of the Maine Jobs Recovery Plan funding, York County Community College was able to start a dental hygiene program, which they wouldn't have been able to start without that. That's a phenomenal resource to the system. And then Central Maine Community College, we had done a needs assessment on a dental program, but it was at about the same time that the UMA program was going to be moving some of its resources to the Lewis and Auburn campus of USM. And it didn't seem like a good use of state funding to start 2 brand new dentist schools in 2 neighboring towns. So we set that aside and are letting UMA do what they're great at and bring it to the Lewiston community. But it is certainly one of our focus, and I'm sorry we didn't get to that. Thank you for raising it.
And I just want to jump in on your first question. So thank you so much for raising individuals with disabilities. Individuals with disabilities are 3 times more likely to be unemployed than individuals without disabilities. And so it's a huge untapped labor pool in Maine. And so at the Maine Department of Labor, we have the Bureau of Rehabilitation Services. Division of Vocational Rehab is serving 6,000 individuals with disabilities with their employment and training plans. And so we use a progressive employment model where we believe everybody is ready for something. So that could be a job shadow, that could be mock interviews, that could be a part-time role, but we're really looking to partner with employers to make sure employers are getting the training they need to best serve individuals with disabilities, and individuals with disabilities are in a supportive environment. So we encourage employers, if you're not yet employing individuals with disabilities, you are. A lot of individuals with disabilities have invisible disabilities, but we encourage you to think about how to make accommodations. They can be small accommodations to really make sure that you're creating an accessible work environment for individuals. So thank you for raising that.
I think we have time for just one quick more question. Yes?
We're
Got one right here, I think.
Thank you. Thanks, everyone, for your great words today. I was curious, I know Jolene mentioned a little bit, but if there were any other examples of sort of the laddering all the way through to to providers, physicians, nurse practitioners, especially in that primary care market?
Yes. I think we're all attempting to build a stronger system that helps people along the path, whether it's a road or a sidewalk. We, for instance, there's 130,000 Mainers who started a baccalaureate program at some point in their life and never finished it. We have supercharged our efforts to reach out to that audience of people to bring them along. We also understand that there are a number of people in the nursing profession that don't have a baccalaureate degree. We're building and expanding those programs as well. We have a physical therapy shortage in Maine, and quite frankly, we're at the drawing board trying to figure out how to help that particular problem through our system. I think everybody up here, I think we're all aware of what the shortages are or what the difficulties are. Our difficulty is funding the answer. And so we have made a very large effort to go out to others in the state, and we're very happy to take state dollars and invest them in higher education, I can assure my colleagues. But we have to really make this a Maine state problem where not just hospital systems or medical systems or universities or community colleges are involved, but quite frankly, the broader audience of people who need to come to the table so that we can address this issue.
Great, thank you. Well, thank you all for your wisdom. Again, this is just a beginning conversation, so.
And another thank you to Joy for her leadership in doing all of this work. So thank you, everybody. We are taking a break. When we come back, you'll be going into breakout rooms. And the best way to describe it is if you want to stay here, if you are interested in growing and upskilling your frontline workforce. Correct, Joy? Yes. Everybody else, the breakout rooms are going to be out here and around, and you'll see signs. Did I get that right? So if you're here, if you're growing and upskilling your frontline workforce, if you're apprenticeship and career pathways or new models in health workforce ecosystem, you'll be walking out and around the corner, and there'll be signs for you.
Chris thought your grant was over.
No, he knows it.
He knows it wasn't?
Yeah, because we just redid my contract about a month and a half ago.
Okay,
We had to do an
let
extension.
me get it.
I don't want to make you
No, it's just that the last couple of things have been okay, but I think we're at a point again. Use me wherever you need. Okay, thank you. It's great seeing you. I just saw the badge. I know. That's cool. That's me.
Nice to meet you.
Be there Thursday. Yep, so I took the flights out of
Okay, yes, definitely. And I'm thinking
anyway.
There's just, oh yeah, it was great. My copy in the car.
It's awesome. So anyway, I'm very much looking forward to it. Allison stood right on top of it.
Yeah. Well, we were like 20-something, so that's probably I'm hoping it's not just it's like in the three areas I think they're doing yes. It's important. It's not like they really do. It's like How am I going to get from this and on to this? Should I take my
We're going to do an exercise.
I'm going to go.
Oh my gosh. So this
That was cool.
is,
My son
as people are thinking about
He's going to be a barber.
Yeah,
taking it out
right.
of control,
Yeah.
and this
It's been the best thing you really, really have.
They already based on where they want to go. Okay. Partnerships, innovation. Here's a whole story. Okay. Yeah. No way.
What time is it going?
Okay. Thank you.
I grew up in Fairfield.
Yeah, so anyway.
I'm so glad.
It's really great. It's just, he's just one of those not ready for college.
So engaging, we have such, there's always been a problem with the student engagement when I was teaching in Civic. Not in my class, no.
It's a tough demographic.
But no, but honestly, it's just such the students are engaged, they have so much say in what they want to do, and they're just educating people. What I'm really excited about, we've been talking for the bill to have same learning opportunities incorporated, codified in Maine statute as a medical education pathway. And it passed unheard of unanimously on the education committee. Republicans and Democrats, and governor signed it. So July 1st, it's yellow is a security pathway in Maine statute. So it gives people like they've had this funding, and then they're trying to go to the school board and say this is really positions, and it gives them leverage to say, and it's in the good pathway. So I'm pretty excited about that. It's so good for so many kids. So I'm glad you came up and looked at that.
Good. Well, thank you.
And where are you? You're DHS.
I'm DHS. I am a policy. I am the policy and program development manager at Gould. So, very aware of the challenges with employing adults with intellectual disabilities, developmental disabilities. Very aware. I come from the Medicaid space, so very aware of how employment impacts their public benefits. Very interesting topics.
Yeah, I like policy. I don't like to be all the front of it. Luckily, the stuff that we do with workforce development, it's pretty bipartisan. It's not conflict. We're not talking about like certainly all the curriculum goals that are happening. They're pretty. It's pretty Well, I hope our paths cross again, and good luck to your son. What is he? What year is he? A senior. Okay, great.
Yeah.
You'll be on the senior stuff.
Yeah, we're working. We're working.
Do you have any other kids?
I have an 11-year-old daughter.
So you're not gonna have an empty nest yet?
No, not an empty nest yet. She thinks she's 25.
Okay.
Yeah.
All right. Well, my 3-year-old granddaughter.
Yeah, that's not going to get better.
Nice
Sorry.
to meet you.
You too.
Do you know what they are?
I should be, yes.
Let's take a look real quick then.
Oh, thank you.
That's an important thing to have, you know?
Yes, I do have time. So I do think I'm going to ask folks to because I want to feel like it's too disparate to one of my community. And so with the audience is there, and then I'm thinking, and I did not know you. Did she know you? Yeah, I can have them to learn on Thursday for the timeline. So let me ask Lorena how she's new. Oh, look, Emily's on the PowerPoint drive. Excellent. Yeah, great. But they're, it would make no sense for someone who doesn't have like really great. Okay. And I don't want to take away your opportunity. She's mothering me. Well, you're also really? Oh, I have 2 guest speakers. Okay, let me see. And did you know who Yeah, Bonnie was just here. She was front row today. She knows we're going to be in here, and there was a line for the bathroom. So that's probably. And so I'll keep my mic.
Absolutely. And then you guys each have a mic. Are you going to talk for?
Yeah, I was thinking, sitting is kind of nice, right? 'Cause it feels way more intimate.
Yeah, and then for our camera shot, we'll just get a shot of the table.
Can't wait.
Why am I being Bonnie?
Bonnie's our
Good thing she starts like 40 minutes into it. Yeah,
she's the third person.
Good. So, all right, one more minute and we're going to get back together. If you are staying here, I'm going to ask you to move up. Otherwise, the room feels a little disparate. So come on up and join some of these other tables so we can get a little more close in. I encourage you. You're already there. That's good. Feel free to move up so that we're all kind of a little tighter in. That means you if you're in the back of the room, because I can be a pain. Yeah, come on up. Come on up so we can have a good close-in discussion. And from the sides of the room, come on in. Come on in. How's everybody doing so far? Marvelous? Great day? How many people have learned at least one new thing today so far that has been helpful? Great. So by the way, and I'm sure Joy's going to talk about it later, there's a kind of action sheet in your packet. Keep thinking very concretely about what you're learning and what you bring home. How many people have also gone to a conference and great ideas, and then you get home and there's how many emails? 50? And 6 meetings, and what gets implemented? How many have had that experience, right? So one of the things I want you to think about before I turn it over to the panel, and I'll do some timekeeping, is think a little bit, and I'll talk about this at lunch a little bit too, but think about very concretely, how are you going to bring something home, right? This is great to hear. There's good ideas. I saw lots of hands. How are you going to bring it home to where you work? You can bring it to your home too, but where you work is probably better. I'm going to turn it over to you.
Good? Great. Thank you all so much for joining us today. For those of you who did come closer to the room, that feels really nice. It's nice to have people in the front row and not be feeling like are you at the conference, or are you getting 102 emails about your teams that you've abandoned for a full day to join us in this conference? And I'm hopeful that it will be very meaningful for you and give you lots of energy. For those of you who don't know me, my name is Angelina Cluthis-Jeanne. I serve as the Director of Strategy and Innovation for the Bureau of Employment Services at the Maine Department of Labor. It's essentially a super lofty title that means that I oversee all things ARPA. And with all good government work here with healthcare workers, right? Of course, we threw an acronym at you in the first 2 minutes of this speech. And so we're going to be throwing some more acronyms at you. And I know I'm in good company, but if you hear an acronym that maybe you don't know and you'd like blink twice, and we'll go ahead and slow it down and get you that acronym spelled out to you. So today we'll be talking a little bit about the American Rescue Plan Act that often gets talked to about as the Maine Jobs and Recovery Plan when we talk about its work in Maine. I'm joined by Bonnie Vaughn, so you can come on up to the stage, Bonnie, when you're ready, and Emily Ferry. Bonnie is a dental hygienist. She's got an MBA, and she is the executive director of the Kennebec Valley Family Dentistry Office. She's been connecting her workers to the Maine Department of Labor to get some training. And then my colleague Emily works for the Maine Primary Care Association. She supports community health centers around Maine to help upskill their current workers. And that's really our topic for today, is talking about current workers. So I'm going to give you a quick overview, kind of as a, hey, quick introduction, what are we doing here today? And then really the point of our time is for you to hear from employers who have worked with the program, to hear what went well, hopefully some things, and some things that might not have gone well that we're working on improving to make better and easier for other folks. As we look around the room, I just want to say thank you for being here. Some of you might have a blue star on your name tag, and that means that someone in your organization has benefited from the tuition remission program already. So for those of you with blue stars, thanks, you've already engaged in this. Somebody in your organization has, congratulations to you. There are also folks who have a yellow star, and that yellow star means that you're an apprentice sponsor, which means that's kind of the next level. Like that's the sustainability plan beyond this funding source, so a great way to continue supporting people. You've heard my colleagues, Sam Dyna, and even Commissioner Fortman talk quite a bit about our healthcare workforce approach. And so we're concerned about the pipeline, where we want to support training, and we're really here today to talk about retention. This is in partnership with so many people. It's so much bigger than the Maine Department of Labor. It's our colleagues at the Health and Human Services, our colleagues at the Adult Education Office, our college in the Maine university system, as well as the Maine Community College system. We have this approach where folks can come through the door on our webpage and hear about opportunities that are available for training. There's two things that can happen. One is that a healthcare navigator can be the real life person on the other end of the form that connects with the person who fills it out. So you could be an employer or a job seeker, and you could say, I want to know how to attract people, or I want to know how to do a job in healthcare, but I actually don't like blood. And our healthcare navigators can help them find the career pathway that's going to be most meaningful for them. We also have some tuition remission staff, and their purpose is to fill the gap in healthcare training that's not already free or not already funded by some of our other partners. To date, 1,186 requests were eligible for tuition remission, and they wouldn't have been funded by some of the traditional things that are always a part of the workforce system. It's a slow process because people have to get enrolled, they have to be in progress. And so right now we've got 480 of those 1,186 who have completed, and those numbers are continuing to tick up on this short-term investment. And you'll get to hear from Emily and Bonnie a little bit about what that short-term investment has looked like for them. It's all a part of a coordinated training website that you've heard about today. You would go to maine.gov/healthcare training for me and press the yellow button to say, help us upskill our workforce, help us find our workforce, help me get a real live human who can guide us through the different opportunities that are available. And so without further ado, the tuition remission program has funded lots of jobs that you all called priority. We polled employers and said, what are the priority jobs for you? And it produced this list of priority jobs from EMT to FDA to acronym after acronym. These are the positions that we have funded so far for workers who wouldn't have been eligible for other funding that existed in the workforce necessarily. I'm really proud of some of these numbers, seeing large investments in mental health, seeing large investments in the creation of licensed practical nurse cohorts, as well as in dental care. And today we'll get to talk a little bit about those a couple of different programs and how they've worked. And so I'm just gonna cruise right through and take a moment to introduce you to my colleague, Emily, who I've had the opportunity to partner with. As I've mentioned, Emily is an incredible partner with the Maine Primary Care Association, who's thunk out of the box about how to make this program work for people in her network. So Emily, if you could do an introduction, and then we'll have Bonnie do an introduction, and then we'll do some questions from the audience.
Sounds good. Hello, everyone. My name is Emily Ferry. I am the Director of Workforce Initiatives for the Maine Primary Care Association. And just to give a little bit of background about our organization, we are a training and technical assistance organization for the 19 federally qualified health centers in the state of Maine and one lookalike. And just a little bit more background about that, our health centers have over 80 service locations throughout the state and serve about 1 in 6 Mainers statewide. And just to dig a little bit deeper, to give a snapshot about our network. So our smallest health center is a fully mobile program, the Maine Mobile Health Program, which serves predominantly the migrant farm workers across the state of Maine. So they served in 2022 about 900 patients, and they are, like I mentioned, fully mobile, so they travel across the state to meet patients where they are. And then on the other end, we have our largest community health center, which I believe is the second largest in New England. That is Penobscot Community Healthcare, and I see there are some representatives from that health center here today. And they serve close to 60,000 patients and have about 20 locations, almost 20 locations? 17 locations. Great. So just wanted to kind of paint a picture of the variety of health centers that we support and the different patients that they're serving. Shoot, sorry. Oh, my slide's a little misaligned there. So just for some context on kind of what led us to the tuition remission program, we were funded by HRSA back in 2022 through the Rural Public Health Workforce Training Network Program, a mouthful, also a very long acronym. And we convene a group of our member health centers to focus on the recruitment, training, and retention of what HRSA called community health supports. And that was community health workers, medical assistants, and dental assistants. So we meet as a group monthly to talk through what are some challenges in training and recruitment and retention, what are some strategies, what are some innovative practices that are happening. And one of the early stages of this program back in August of 2022 is we met and kind of talked through what the network was seeing around who are they partnering with to train these roles, and then what opportunities were needed to fill skills gaps. So this is a list of our Maine Workforce Innovation Network. We call ourselves Maine WIN. So there are 12 health centers listed there, and then we have a variety of training partners that we work with that provide some sort of training. For example, MCD Global Health, we refer newly or current community health workers to their core competency training that they offer to CHWs throughout the state. So the impact of the tuition remission program, I don't know why this slide's a little messed up, I'm so sorry. We wanted to, like I mentioned, figure out kind of the landscape of Maine in terms of medical assistant training offerings, dental assistant training offerings. And so a few of our health centers are partnered with the community college system on medical assistant training. One of the things we wanted to do is figure out what additional training opportunities our health centers might get connected with in very rural areas. We know that some of our health centers were already doing on-the-job training with their staff that they were hiring, and we wanted to connect them with a formalized training program. So we kind of started exploring in our networks. We are in a network with other primary care associations across the country, and we heard about an online allied health training organization called Career Step. And we started interviewing other federally qualified health centers across the country who were implementing this curriculum as on-the-job training in their health centers to hear how it was going and if it was valuable or not. So we held some exploratory sessions with health centers in our state and other states to just kind of talk through what that looked like for them. And so that kind of led us to a partnership with the organization Career Step. So we offer a partnership for medical assistant and dental assistant training. And what that looks like is a health center who wants to engage in, let's say, dental assistant training is either hiring to train, so that earn while you learn model that we've heard so much about is something that they're implementing, or they're upskilling their current staff who might not be certified but are interested in formalized training. Because we are hearing that some health centers, their dental assistants or medical assistants are not certified, and they're interested in expanding their learning, their career growth, and ultimately becoming certified. And so what we've seen is that there are some very rural health centers that are taking this training and really making it their own. One of the focuses of our program is retention. And we were hearing that there were staff members who were leaving fairly quickly after being hired. And after exit interviews, the feedback was, well, we didn't feel prepared, or we didn't feel like our training was enough. And so what this program allows is for health centers to cultivate sort of an in-house training program, make it their own, with online learning and clinical learning hours on the job. So you can see on this slide, there are 9 FQHCs who are engaged in that online MA program that I mentioned. And right now there are 26 MAs that are enrolled in the program. There are 6 FQHCs who are engaged in the dental assisting program with 12 dental assistant trainees. And right now, of those trainees, 49% are current staff who have been working as an MA or DA, and they are currently going through this formal program, which will ultimately allow them to sit for the certified medical assisting exam. And then there are 51% who are new hires. So health centers were posting, we are looking for an MA trainee. We will hire you, we will pay you, and we will train you on the job. So right now we have 4 trainees who've completed the program. So to circle back to the tuition remission program, as we were kind of rolling out these connections to training programs, including the Career Step program I mentioned, we were only going to be able to cover about 1/5 of the trainees who are in this program right now, based on our funding through our federal grant. And so I had heard of the tuition remission program, and I reached out to Angelina and some folks and just said, you know, we have a group of learners that are interested in going through this program. How can we support funding for the tuition? And they said, no problem, which was pretty phenomenal. So this program has really allowed for our health centers to grow their own on-the-job training by this covered tuition program, which is pretty amazing. And they're able to, they receive funds for our program to go towards training and retention. So they're able to filter those funds towards stipends for preceptors, bonuses for the folks that are in the program, or other retention efforts. So through this support, we're able to get a bit more creative with our funding through our program.
And I think up next, what we'd like to do is maybe have Bonnie go ahead and share. And Bonnie, I've put together, you've got your slides as well with that nice big green button. And after you've kind of heard from all 3 of us, we're really excited about audience questions to see how we can figure out what you can learn from my colleagues who have done a great job using the program, or what you might want to learn about how you could use a program like this or other opportunities to engage. So Bonnie, with all of your incredible credentials, having served as won so many awards, starting off your career as a dental hygienist and now really leading the Kennebec Valley Family Dentistry office, I'd love for you to just share a little bit about your story and your relationship with the tuition remission team.
It's on. Everyone, it's on. Okay. Thank you very much. This is kind of overwhelming to be up here.
It's not on.
It is.
You just have to hold us
a
little closer.
Am I on now?
Yep.
Okay.
A little closer.
Now?
Yeah.
Perfect. Okay. I need tutoring here. Thank you. I am a dental hygienist. I have been in Maine for many, many years, working in private practice and in public health. I joined Kennebec Valley Family Dentistry, which is a 501c3, nonprofit, little tiny entity, in 2014. We had a clinic in Augusta, 4-chair clinic, which was very crowded. It was in a building that was dilapidated. The partner, our medical pedo department, was moving out of the building. They said they're going to the Ballard Center. I said, we got to come with you because you have all our patients. And it took us 3 years to raise enough money to move from 269 Water Street to the Ballard Center, which is the old Maine General Hospital. So we went from a 4-chair clinic to an 8-chair clinic. Let me see if we can get, how do we move this forward? Our mission as a 501c3 is to serve underserved populations, and we have services by dentists, hygienists, assistants, endodontists, and pediatric dentists, so we're lucky. But we are a 501c3, so we're a nonprofit agency. And our biggest population is Maine Care, and I did mention that we do x-rays.
There you go. Perfect.
I need more instruction. Thank you. X-rays, oral evaluations, propes, cleanings, deep cleanings. We do sealants, and then we do the full range of restorative dentistry too, fillings, extractions, etc. We have 2 full-time dentists at this point and part-time. Years ago, we started with part-time senior dentist, and we've moved on to be able to hire full-time dentists. Both of these dentists are University of New England graduates. Dr. Martin just graduated last May, and Dr. McPherson graduated a couple of years ago. So we are very pleased to be able to have full-time dentists in addition to some of our part-time dentists. Dr. Badger is one of the pediatric dentists that works for us and also works at UNE. He's with us 1 day a week and also has done some OR surgery at Maine General here in Augusta. Dr. Nick is an endodontist, semi-retired, practiced in Georgia, moved back to Maine, so he's working with us 1 day a week. He's probably one of the only endodontists in the state that provides services for Maine Care clients. None of the other little entities have any endo services. This is basically a breakdown. We have dentists, as I mentioned. We now have a dental therapist. This is an entity that is a hygienist in Maine. It's that the law says it has to be a dental hygienist, and it has 2 more years of advanced training, so they actually can do the drilling and the filling and some extractions. And we were lucky to hire a therapist this year who graduated from one of the Minnesota dental therapy programs, and she is fantastic. She works a lot with the younger kids doing nitrous and doing extractions and fillings, and it's just awesome. I do want to talk to anybody in the room about the proposed dental therapy program at the University of Maine in Augusta. Legislation has passed. We're waiting for a report to come from the division on how we can start that program. Hygienists, we have 4 or 5 part-time, full-time hygienists. Several of them are actually, probably all of them are from either one of our 2 hygiene schools in Maine, one in Portland at University of New England, and one at the University of Maine in Augusta, actually located in Bangor. And we have assistants and front desk people. So assistants is how I fell into this wonderful program of the fee, what do you call it? Tuition. Nice. So I don't know how I got hooked into this, but after the pandemic, all of the dental entities were looking for staff, and somehow I got networked into a group where how do we train dental assistants? And the wonderful staff said, you send me names and we'll pay their tuition. And the program has been wonderful for us as a nonprofit, small clinic, providing the best services we can. So the assistants came off, basically applied for a job, untrained, and the state has set up this wonderful dental assisting program where they're with Dr. Rose, who's over there, and she does a lecture. It's a 10-week program. They do a Zoom class every Monday night for 2 hours, and then they're in the clinic with us 40 hours a week. So everything that she teaches them Monday night, they get to see the next day and practice all week, and it's fantastic. And we've had quite a number of young ladies who have been interested in the program and have successfully completed her 10-week program. I'm going to be signing up a few more, and I believe I have a few more people that want to be signed up for the AFTA program, which is an expanded function dental assistant program. And this program teaches either assistants or hygienists how to do packing of the materials, the composites or the amalgam. So the dentist does the drilling, the AFTA does the actual filling of the tooth. So we are hoping to have some of those students come back and work with us too. So this program has been fantastic for us because limited budgets, limited salaries, but we've been able to recruit people and get them trained, and it's worked. The design of the program with the 2 hours of Zoom for 10 weeks and the hands-on every day has worked really well for our environment. And some of our assistants have gone on to other jobs, and that's probably okay, even though I'd like to keep all of them. But it gives them the first step of what to do as a dental assistant, gives them a lot of experience, and then they can apply for other jobs and move on. So it's been very, very good from that point of view as far as their first job and how to get started. And it gives them an environment of working with other licensed professionals in our field. So that's how I've networked with them. Let me see what I have with other. So, other good point, I'm glad I have the slide here. We actually have University of New England dental students that come to us for rotations 10 to 12 weeks. We have 3 rotations every year, and it's either 1 or 2 fourth-year dental students. It gives them a fantastic experience, seeing lots of different dental needs in all ages. We start seeing kids at age 1, which is something that they don't see at their dental clinic in Portland. And we have no end at the top, 93 to 99-year-olds. So they get a wide range of patient age, and they also get a wide range of dental needs that they also don't get at their clinic in Portland. So we've been using or having the students come to us since 2018, which has been a big benefit for us as a low-income clinic to have their expertise and experience. The other students that we have is the University of Maine dental hygiene students, and they started a rotation with us 2 years ago. And these are senior dental hygiene students, and they did not have another outside rotation, so that they only had their clinic at school. So this was another benefit for them and for us. It gave them an experience to see younger kids that they didn't get in their clinic, and it gave them an experience of what is it like to be in a dental office? How do I treat all the patients? How do I schedule it? How do I work with a computer? How do I take x-rays? And how do I do it all in an hour? So it was a really great training experience for them. So the first semester they come in pairs and they work together with their patients, and they also have the dentist come in and do their exam, which is something they don't get in their clinical experience in Bangor. And then their second semester they actually come and they have their own column of patients in their own room, and they serve their patients and have the dentist do the exam. They do all their entry on their computer. So it's a really great learning experience for them. So we're really pleased to have both of these connections in the state and with us in our Augusta site.
So I think we've got less than 15 minutes left, and I don't want to, how do we balance getting addressing the questions that you all probably have, right? Like, and so I don't know, Bonnie, do you want to wrap things up, or shall we?
One more comment.
Okay.
You can see the circles here that the main population that we have is Maine Care, 82%. There's very few dentists that take Maine Care, so there's 6 public clinics, and we have the burden of most of the Maine Care population.
So folks can obviously visit maine.gov/healthcare training for me and then get connected to my team, which is amazing. And sometimes they'll connect folks directly to Chris Winstead's team from the Maine Community College, and we'll say, oh, there's actually already a great free thing happening. You don't need us. And sometimes we'll say, well, it sounds like some of your workers have significant barriers to employment. Let's get them connected to someone like Mike Robinson from Goodwill Workforce Solutions, or Aaron's team that shows up from EMDC, or our partners in ACAP, so that they can get the full wraparound services. But we have people coming into this website all the time. We can't fund everyone, and in fact we might run out of funding as early as July. Our funding does sunset completely in December 2024. Individuals asked us to fund them, and we said yes, but we really wanted employers to ask us as a retention tool, and you all didn't press the yellow button as often as I had hoped you would. And so would love to know from you what's preventing you from pressing the yellow button. Please do it today. Or how can we help you press the yellow button, or why didn't you press the yellow button, or what? And then of course any other questions you might have for Bonnie and Emily about when they pressed the yellow button. Was it as bad as other government things might sometimes be, or were there some additional or any other questions you might have? So the floor is yours for the rest of the time for any questions you all might have. And Sarah's running around with the mic with her speed and agility. So,
as Maine is the nation with the highest population who are elderly in the nursing homes, group homes, or home care, that I see the crisis here to train staff and to keep them in these facilities, as most nursing students believe the hospital is the glory place where you go when you graduate nursing school, to attract and keep people in these situations with the decrease in funding that's happening to these places, how are we going to keep staff and train them more with the increasing costs that are occurring?
It's an excellent question. And so what I'm just to make sure I get it right, your question is, beyond this funding, how do we keep staff in their positions? And I think that lots of employers in this room have best practices, and a huge part of today's networking is to maybe share what's working and not working. At the Maine Department of Labor, we've seen people say things to us that about why they stay in their current position, why they don't care about somebody's amazing sign-on bonus. I'm looking at you, Northern Light. Like that they're so happy with their current employer, and it's because they feel invested by their current employer, that their current employer has helped them figure out a career pathway or what the next steps are, or is listening to them, or their leadership is excellent, and that's why they're not attracted to some of those other positions that they might be. So those are some good takeaways, and I wonder if others in the room want to share, or if our panelists want to share, what is keeping your workers to stay at your FHQs or at Kennebec Valley Family Dentistry? What makes them stay? I'd love if you've got a best practice to share, and hopefully tuition remission is one of the reasons, but I'm sure there are many.
I think part of it is the community and just the other staff that's been so supportive of new employees, and I think that's part. We're small, but we're very supportive, and you can see 4 of our young ladies that are up here on the screen, and it's just, I think that for us has been the support. But I don't know your question actually about going ahead. We're always going to be in need of funding, either to raise their raises to their salaries, or to cover the increased cost of dental services and supplies, etc.
I think I have a unique sort of stance on this panel, whereas we are not the employer. We are connecting our employers, our network employers, to the tuition remission program. But I will say, I think a focus of the program I mentioned, our WIN program, we do a lot of sharing of how are we keeping our staff. And I think it'll be interesting at the end of our program to see, if we have 50 folks who've gone through this on-the-job training program, what the retention rate is after that, to see, some of these health centers who are really pouring into bringing someone on board and onboarding them into the culture of their organization, and how that connects to retention. Because I think we can train people, and what we are seeing is people were being hired and then they were leaving, and then why were they leaving? So I think a big part of this too is supporting workers and really embedding them in the culture of the organization, and that's something that we talk a lot about on our calls, where we're kind of problem solving and talking through a lot of these things.
May I ask a question before I hand it over to Michael? Is tuition remission allowed for supervisor training? Because to what you were just kind of noting, the number one reason folks leave their job is their supervisor. And in previous work I've done, I've seen the importance of helping supervisors understand how to be coaches and help people to stay as retention. So I don't know, Angeline, if they are, if it is.
We're super focused. It have to be a frontline healthcare worker who's a previous worker or a separated worker, but that's where our partnership comes in. That website, there's no wrong door. And so the right door for that case is often the compact. We send so many people to the compact to fund and meet people on those needs. And then if you're not already a compact member, please go over and visit Chris Young, so you can become a compact member.
He's raising his hand over there.
Chris Young can help folks who aren't a compact member yet take advantage of it, as well as folks who are a compact member figure out a great strategy to get that.
That's what I thought it wasn't, but I wanted to make sure. I just think it's an important point that you can train, exactly, but if you don't have the kind of supportive culture and staffing, it's very hard to retain, especially using DEI as a lens. Yeah.
I was just going to say that we offer supervision management training through the program I mentioned. It's not funded through tuition remission, but that is something we definitely prioritize in our program. And I think it's really important to, as you're upskilling and reskilling and also advancing staff in your organization, you're finding people were getting promoted, but then didn't have that training to be in a managerial role. I think in healthcare, people grow frequently. And so, yeah, I think that's a really important point in the retention aspect of things. And there's a lot of good resources out in Maine and nationally around cultivating leaders in an organization.
Great.
Good morning. Thank you for your effort up here. I just had a curiosity. Do we recruit former military that are getting out? I mean, you can't get any better training in either healthcare, can be just a potential workforce, but in healthcare especially. I mean, we could be going to high schools, guidance counselors, finding out individuals that went into the military that possibly had a background in healthcare and recruit them just like normal recruiters would go out to college graduates. But the training that you can get in the military, I spent 10 years myself in the military. I just think it's an untapped resource that our employers could be looking at on their own, as well as some of our companies out there that are recruiting headhunters and things like that. Thank you for your time.
One of the things I love about tuition remission is that we can pay for the license. So sometimes the people have all the training and all of the experience, but they don't necessarily have the license, or they might need an additional course to get the license. We've funded a variety of programs that are past medical experience like paramedic, but not called paramedic in the military, all the way to help people become nurses. And that can be a really meaningful way to leverage people's past experience and get them that license that they need in a quick way. And so we often work with veterans. Many of the people who have benefited from tuition remission haven't needed the full class, but they needed something to get across the finish line, and they wouldn't have been eligible for other programs necessarily. I think that's veterans do have access to many things, but not all of the things speak to each other. And so being able to fill that unique gap has been really meaningful. And I'd love to know if Emily or Bonnie have some insights about how you've worked with veterans as well.
I don't have insight into how our employers have worked with veterans, but I do know that the state has the Hire a Vet campaign. And I'm not sure how many of our employers have signed on board to that, but that is a direct kind of program to get to funnel folks who are veterans into careers throughout the state, and I think there's a big healthcare focus there too.
I didn't know about that program, but I'm going to sign up for it because in the past we have had retired dentists work for us, but we didn't have a formal recruitment. But you'll be interested to know that there was a legislative bill that was just passed, and Maine was number 7, which this compact program need to have 7 states sign up in order to have a compact where dentist and dental hygienist from another state who is licensed, who could work through one of these 7 states and that could come here to work without jumping through all the hoops and being relicensed in Maine. So that's brand new. It just got signed in June by the governor. So we're really excited to be part of that. Dental hygiene, dental compact program. So hopefully that will bring some retirees.
And folks, we've got just 5 minutes left, so I think that's one question, and we've got the question asker already identified. So
could be 2 questions.
Could be 2, depends.
This might be short. So I just read an application from a school district that, and my name's Charles, I work at the Maine Health Access Foundation. It was to basically train up some of the community health outreach workers and teachers' aides that have been assisting teachers in classrooms to become social workers. And I thought it was a great idea. I didn't know about the sustainability of it necessarily, and I wondered about is that something that this school district could use tuition remediation for? Because the social workers are, focused on behavioral health services and the other things that social workers provide. But I was just curious, could those incumbent workers that are already there make Does that
so
sound
close
like it
on the
could fit?
eligibility. One missing piece there. The reason they're a no for us, but not a no for others, because there are others who can help, is that we only fund short-term credentials, must be less than 18 months. And becoming a licensed clinical social worker is so much more. So we've been lucky to fund things like IPDH, independent dental hygienists, which is a short-term credential, or EFTA, which is short-term expanded function. We can fund LPN, we can fund the bridge to RN, but you already have a bunch of stuff, but you're not quite an RN, but we can't fund the associate's degrees or the bachelor's degrees. There are other programs out there, and I'd love for that school district to reach out so we can get a real live human, like the ladies at our table for tuition remission team, to on the other end to figure out what are some options that will work, but degree programs tend to be a bit harder.
Right, the question becomes stackable credentials sometimes, right, where there might be the ability to get some stackables that then eventually lead that way. We have time for one more question, Erin? Erin, and then we'll come over here. We'll try for two. Let's see if we can squeeze it.
Just a statement and then a question. The statement is this money's going to go away, so we've got to figure out through WIOA, Workforce Innovation and Opportunity Act, how we can continue on. The question is, one that Angelina asked, if employers aren't hitting that yellow button, if they're not asking for the service, I would love to know why.
Any employers want to answer that question? Come on. I have no idea how many employers are in the room right now. All right.
I'm answering as somebody who did push the yellow button, or one of my team members did. I think it's knowledge. I think there's a gap there, with the end users and knowing what resources are out there, it being feasible and there being a certain level of ease to it. The component of staffing is stretched beyond means sometimes. So having somebody with the knowledge base and the level of comfort and the resource, it continues to build into a situation that it just doesn't happen.
I have some discomfort as well, as early yellow button pushers might not have had the same experience that late yellow button pushers had, because it's a new program. We were building it. We were figuring it out. So if we've dropped the ball, don't let us come back, please.
All right, last question.
So my question is regarding the dental hygienist program. I'm interested to know, is it just the one clinic that is working with you in these programs, or are they other throughout the state? And also, what's the potential earning to those that go through that program, if you have an idea or a guesstimate?
I'm going to ask Bonnie if you'll talk about the earning, and I can just say, we can say statewide, we've had a number of businesses ask for us to train people with dental assisting, and using the Academy of Medical Professionals as one of our training providers. We'll use any training provider you as an employer like or want. We're very agnostic about the training provider. If the employer's like, this is going to get my person what they need, that's what we need. But we like the Academy of Medical Professionals quite a bit because it's hybrid. Folks can do it most of it from home in many cases, and so that's been working really well for us, and we have been able to serve folks all across the state, from Calais to Eustis. But I don't know about the earning potential, so I'll make Bonnie do that.
Let's go back to your questions. Can you give me one of your questions? Oh.
So I just wanted to know, just so that I can tell others about this program. Through the dental hygienist program, like, what is the potential earning for somebody that completes the training?
The salary for hygienists is unbelievable. Coming out of school, they make $40 an hour, $40 to $50 an hour. They can name their prices and their benefits. And that's because of COVID and so many people lost or just left the field. And dentists were really desperate for hygienists, so their salaries have gone way up. And usually their benefits, same thing. And your other question was? That was it? Okay.
And we are at time.
We're out of time.
We're at time.
Folks, thank you so much for coming and for engaging in this panel, as well as just attending the conference in general. Taking a day off of work to be here is wonderful, and we do have other folks coming in from the other breakout rooms now, but we're going to stay up here if you've got more questions.
A big thank you to the panel.
Is there a way to get copies of these
So just want to do one quick check before I introduce our panelists. So how many folks I did this with the folks who are here this morning, how many folks have gotten at least one idea to bring back to your organization thus far? And those of you who were here this morning know what I'm going to say. How many of you get a great idea and then go back to the office and the emails and the phone calls and the meetings hit and there went that idea? How many people have ever had that happen? So, as you're listening, as you think about what you heard this morning, as you're listening this afternoon, as we're going through the sessions, think very concretely about how you're going to take these ideas that you have and bring them back. Is it to a coworker? Is it to a supervisor? How are you bringing these ideas back so that they actually become actionable? So I encourage you to think that. And we'll do a little work at the end of the day for that, but sometimes it helps to begin thinking about it now, not just at the end of the day. Alrighty, so with that, we are going to be talking about resilience and retention, a theme that has come up more than once already today. Kelly Strout is here from the Orono School of Nursing, and Sheila Thibodeau from Wellness Services for Healthy Life EAP. So they are both going to be doing separate presentations with a Q&A in the middle of it. We'll do that. We'll take a brief break. We're going to go a little bit into the break time, and then we'll be continuing on from there into the breakout sessions. So, Kelly, I think you're up first.
How do I make this green? Oh, green. Yeah. There we go.
It's not. It's green.
I don't know. It didn't go. I just told my table that I thought I was technically savvy, and I'm just not. Okay. Thank you so much for having me. So we were very fortunate at the Maine School of Nursing to be awarded 2 large federal grants to address diversifying the nursing workforce and addressing burnout and resilience in nursing. And there are numerous research studies embedded in these 2 grants, and today I'm here to present some preliminary outcomes. And it's really difficult for me to show you our results without telling you everything we're doing, because likely it's all affecting what we're seeing. I also just want to say that although I'm leading these grants, this work would never be possible without the support of the entire team at the School of Nursing. And we've just had a tremendous team working on all sorts of creative innovations to address retention, improving quality, and addressing burnout and resilience. There's a lot of, mostly what people say to me when we talk about this nursing shortage, we're in a critical nursing shortage in the state of Maine, nationally and globally, and they'll just say, well, increase your enrollment. Like, why aren't you increasing your enrollment? The number of times I get asked this question, and we really in the School of Nursing, although we increased slightly, we're taking a different angle on the nursing shortage, and we're focusing on those students that programs admit and never graduate from nursing school or don't graduate on time. And it's a large percentage that we do not talk about. So in our program, we're focused on retention, and we're doing that through improving quality, addressing mental health and well-being, because although we had many challenges pre-pandemic, the pandemic has accelerated and exacerbated emotional health and well-being and academic preparedness of students. The students we receive simply have major academic gaps, and they are in a poor emotional state. And that's what we're aiming to address. So across the 2 grants, we are looking at increasing access to nursing education for underrepresented groups, and we're also looking at addressing resilience and burnout, because another major contributor of the nursing workforce shortage is nurses just leaving the profession because they're burnt out. So our goal is to produce a high-quality nurse that's resilient to burnout of the healthcare system. So when we were first awarded, we just collected baseline data of our population, and I'm just presenting the undergraduate population data. So as you can see, stratified across our curriculum, the first year, second, third, and fourth year students are all at high risk for burnout. They essentially come to us burnt out, and then we graduate them burnt out. But all we hear about is how the employers are burning them out. In fact, they were burnt out before they arrived. So we are taking a stance on this and saying somewhere along the line, we have to break this cycle. The same with our perceived stress. We have significantly high rates of perceived stress across our curriculum, which we're aiming to address. So
as we look toward diversifying our workforce and addressing all these issues, it's a comprehensive approach. And we really want to increase access to students from all populations, but we can't just say, oh, we've increased our enrollment of first-generation college students if we're not setting up a system where they're going to be successful. So every student we admit at UMaine Nursing, we are committed to supporting all the way through graduation. We don't over-enroll or make them take special tests so they can demonstrate that they can succeed in our curriculum. We're providing supports and a system and a culture that supports their success. So each of these could be their own presentation, and I don't have a lot of time, so I'm just going to give you a very high-level overview. We established a DEI committee and created a 5-year strategic plan. And the strategic plan was really important because nursing has a lot of opportunity. So I'm just constantly being asked, like, why can't you do this? Can you do that? Can you start this program and that program? And it was feeling quite chaotic. So our strategic plan is focused, and we're laser focused on achieving these goals in the strategic plan and improving the quality of our program. We also implemented holistic admission as part of our strategic efforts, and we were only admitting students based on their SATs prior, and our enrollment of out-of-state students was predominantly our entire enrollment was out-of-state students, and the healthcare system partners really hated this. And we've heard it today that there's a lot of data that if you're going to work in a rural area, you grew up in a rural area. So we consulted with some national consultants, changed our admission criteria to address this inequity, and I'm going to show you some results of that. We also established a School of Nursing Living Learning community, so all of our first-year students live in the same dorm, and we implement interventions in that dorm, on-site advising, dinner with the faculty, and all sorts of other things. We have now peer mentoring embedded in our curriculum. It's an assignment in the 4th year. Senior students will mentor first-year students, and it's required. It's just part of class. We established a wellness room. We do a lot of team building and community for our whole population, including faculty. Just last weekend, we had a race on campus, the Healthy High 4K. In the pouring rain, we still had 140 people show up in the School of Nursing. We've implemented mindfulness-based stress reduction, and that could be a talk in its own self. MBSR is a highly researched intervention that addresses emotional health, perceived stress, and addiction, and all sorts of other health outcomes. We have consulted with national experts in nursing on DEI, and the final thing, and I cannot stress this enough, curriculum transformation. The way our courses are designed, the way they're taught, how we're educating faculty to teach students, and what we're seeing is the most important intervention is happening in the classroom. And so we could do all this other stuff, but really, if we want to improve quality and outcomes, we have to have high quality classes. In addition, so every semester we look at data, and we're not just like continuing to do things that don't work, we're just immediately pivoting when it's not working. And we decided, okay, we just need to completely change the way we bring students into nursing school. So now it's required that all students that was starting this year come to campus a week early. They arrive, we have an evidence-based curriculum that includes mindfulness, yoga, healthy eating, physical fitness, belonging, connection, academic advising. It's 6 days, 40 hours, and then they're enrolled in a 1-credit course through the whole semester that gives them booster doses of these interventions in small sections with trained faculty. We are partnering with major groups on campus, and we work with these people every day, and Brown University is providing our mindfulness training for certifying teachers in mindfulness-based stress reduction. So this is where we're at. These on the blue, and it wouldn't let me change the color. So on the far left, the 13%, that's our 5-year mean of recruitment of ethnic and racial minorities. And we did 5 years because COVID just messed all data. It's just created chaos. So that's 5 years, 2020 and before, it was about 13%, and we're about the same. So we really haven't made a major dent, and that's, we could talk about that, and we will aim to address that in the next revision of the grant. But where we've made a major impact is on first-generation college students and in-state enrollment. So our mean before was about 23% of our population was first generation. We've risen to 41%, 35%, and this incoming class is looking about the same. And also we've flipped our in-state enrollment to 70% in in-state students. Now, this is just retention across our whole program. This isn't stratified by first, second, third year. So on average, COVID and 5 years before, we were retaining students about 82%. But In 2022, we were at 85%, and this year, I get those data in the fall. I'm anticipating an even higher percentage because this is a result of our interventions building. But at 85%, given the emotional state of students and the severe academic gaps they're having, to even increase a little is a huge success, because I cannot stress enough what we're seeing. The population is totally different than it was in the past. Our mindfulness-based stress reduction classes we've been running for the past 2 years, and we are seeing statistically significant improvements in perceived stress and increase in satisfaction with life. And this is now a course that students can register for credit bearing, and we've actually opened it up to the whole university. And this spring we had students from other health disciplines. And this is just an example of what students are getting from the course. This spring I collected a mid-semester evaluation, and this student says, I haven't puked from stress in 2 months. This is the longest I've gone since 2016. I'm not having as many tension headaches, and I don't feel anywhere as near as out of control. And having spent the past year with students intimately, I can tell you they are suffering. It is a crisis, and they need help, and they're very receptive to it. We have awarded a lot of money to first-generation college students, and every time we have extra money in the grant, I do a budget reallocation and put more money towards scholarships. So 23-24, we'll have another $50,000 added for the revisions that we just did. And people have been saying this all day, money really matters. And these are our retention data for first-generation students, and it might be too small to see from there. But the first full year of our grant, first-generation college students who received a DEI grant were retained at 83%, and that's compared to 77% non-first gen. The next year, it was even higher at 93%, but if you see that blue, the extra 7%, they still were retained at Maine. So we retained 100% of students in college by giving them scholarships. And we're retaining students at a higher rate than non-first generation, which you typically wouldn't see. And these students really benefit from not having to work as much because our major is so rigorous. So these results are just, we collected data the first, when students arrived at the end of the first week of our bridge week that I told you about, how we're bringing students in, and then at the end of the semester. And we looked at the total population, and we did see statistically significant reduction in perceived stress, even though it was their first semester of college, through all the interventions we were providing. But then we took it one step further and looked at the difference between students who progressed and students who did not progress. And we did have 93% of students progress in that first semester. But those students who did not progress, meaning they did not pass a course, did not meet our standards, or transferred, had significantly higher rates of perceived stress than students who did progress. And we took these before finals. This is before they even knew. I mean, they probably had an idea, but we collected the data the week before finals. The same is true for burnout. And the burnout, students who did not progress had statistically significant higher rates of burnout than those who did progress. We are, there's a lot of work still going on. These are 4-year research studies, and any academic intervention does take 4 years at least to see its effect. So we're looking at expanding mindfulness-based stress reduction, and we're working to certify more teachers. We're hoping to have 5. We've started expanding our mindfulness opportunities to other schools of nursing and other healthcare employers. We just ended a class on Friday that we opened up. We also want to start to increase enrollment in those classes on campus. We are meeting with each group of students, each cohort of students, to just learn about what are system issues that are causing their stress that are free, that we can fix, that are like us creating stress for them. We started doing that this spring. It was very eye-opening. The great thing about most of this is it doesn't, besides the scholarships, like fixing your structural problems it doesn't cost anything. It's just like learn what you're doing that's silly that could address stress. We also, so the students that were enrolled in that first semester course completed lab reports on their health and well-being, and anecdotally, as faculty, we were all reading through them, we were learning, the campus environment is actually causing not conducive to wellness. The food, the noise in the dorms, on and on. So we are going to really do a more formal analysis of that to see what could we do at the campus level to support students, because it would support all students, not just nursing students. And then more intentional analyses of the other interventions that I only barely touched on, which are Master Chef and Fit Nurse. And then we're going to look at these data longitudinally to see, have we reduced perceived stress across our population and reduced burnout? Are we graduating a less burnt out nurse through our intervention? So that's that, and we are going to be reapplying for these grants. So this work is really just beginning. Thank you.
Do folks have questions for Kelly? Questions? Yeah.
Hi, thank you for that. I'm just really curious about how you maybe envision packaging this or sharing this with employers, because this is a tremendous amount of work, and many of these nurses work once they graduate in our hospitals and nursing homes. And so how can employers continue to create these environments that maintain these supports, because clearly they are helping?
Yeah, that's a great question. And last week I presented for some healthcare leaders in our area, and we were getting a lot of requests to bring this to the first year to orientations. And at that time, we just didn't have the capacity to expand beyond what we had committed to. But starting this year, we are going to start partnering, at least with the healthcare employers close to us, to offer more on-site training, mindfulness-based stress reduction in particular, to healthcare partners. And there's another person that I've met in the MBSR training who's actually a physician at Northern Light, and we're talking about actually doing something in partnership with their residents and our nurse residents, which I think will be really great. So we do plan to expand, and that will likely be the grant the next application that goes in next year. I'm going on sabbatical. And that's what I'm going to be working on. So we do have that intention to expand, yes.
Other questions?
Right there.
Right. Back here. Question. Folks who haven't had a chance yet.
Thank you. I was wondering, you mentioned that curriculum redesign was taught. I wondered about your findings about the curriculum, what needed to be changed.
Well, in addition to modernizing, we also have new essentials that we're expected to implement from our national accreditors. So there's been a major curriculum revision related to that. And that was born out of research that new grads just simply aren't prepared for the reality that they're entering. That's the reason why our national test changed as well. So in addition to just content revision and curriculum revision, we really focus on curriculum design, and we've been following inclusive teaching design as our model to design all our classes in an inclusive teaching format, which is, it's a whole way of designing a course. We've worked very closely with our Center for Teaching and Learning Innovation in creating professionally designed videos and flipping all our classes to active learning and case-based learning, transforming our simulation lab and the way we're using simulation. That could be a whole talk, yeah.
Could you, for imagination, give just one example?
Sure.
One concrete example so folks know what.
Sure. So inclusive teaching design is set up so that students know exactly what to expect, what's asked of them. There's not a hidden curriculum. There's not like, ooh, Kelly's trying to trick me. What does she really want? It's everything is given to students up front. There's no trick. So they're provided with rubrics and instructions that are, why am I doing this? Why is it important? How am I going to be graded? How much time is it going to take me? And then all the resources they need, sample papers with feedback from students who did well or didn't do well. And then students are provided these professionally designed videos to share with them core content that they need to become to class prepared. And that's all based on science of how much time can students really focus, which we're learning is about 6 minutes. So it was like 20 minutes when I started education. Now it's 6. So every video is designed in a 6-minute clip with core content, and it has pictures and video, and also there's scripting. So we have accessibility. So if you're a more visual learner, then you can read the transcripts and watch the video. And then they come to class, and the class is set up as case studies and working through real case studies. And then the faculty, assess their thinking and pull out how they're approaching the problem through clinical judgment. And yeah, so that's where we've aimed to go with all our course design.
Thank you.
Yeah, thank you.
Help. One more question? Anybody have one more question?
I was curious if you're going to be measuring the students' resilience or stress reduction once they're hired, and possibly longitudinally over time to see, in fact, whether they are more resilient.
Yeah, that was the original plan, and it's a long story, but yeah, we didn't quite get there. It's a lot of manpower to make that happen, because everyone also gets a Fitbit, and then there's a database on the Fitbit that collects the Fitbit data, which is really cool. So we were thinking, this is amazing. They'll go to practice, and then we can look at, it's not like Kelly Strout's data is that, this is what it is, all, de-identified, but we could see how they're sleeping. And so again, that's gonna be our next grant, is to really look at how this work transfers into practice and how we can collaborate better with the practice environment.
Thank you, Kelly.
Thank you.
Round of applause for Kelly. Sheila. Sheila, do you have slides?
Yes, I do. Oh, it's a good thing you told me how to go backwards. Good afternoon, everyone. I'm so pleased to be here. As mentioned earlier, I'm Sheila Thibodeau, and I'm with Northern Light Healthy Life EAP. We are a Maine-based full-service employee assistance program, and we serve over 120 client companies. Strengthen Me started as a federal response pandemic grant, and we were invited by the state to partner with them to build out a program to support our frontline and healthcare workers statewide who were caring for everyone else as we were trying to navigate the pandemic. So our program has been very successful and funding has continued. However, the focus has shifted over the last 18 months from crisis support needs to more of a reconstruction approach. And I'll talk about that a little bit later. So as the state's primary partner in bringing support services to our frontline workers and leaders across Maine, we have learned so much from this amazing group of people, particularly around the issue of resiliency and the role of connection within retention. So a little bit about us. We started this work in February of 2021, about 10 months into the pandemic, and we rolled out with providing immediate support needs to healthcare settings, hospitals, clinical settings. And since we've expanded that to include others, educators, social service agencies, community action programs, as well as shelters. This has given us an opportunity to hear from a variety of individuals what their needs might be, and also how those needs have shifted over the last 3 years. So our approach was threefold. Clinical support groups. This was either by critical incident responses or by team processing groups. Second, we offered education, trainings. And third, we offered individual support sessions, work-life coaching sessions. Anyone who was eligible for this service was eligible for up to 6 free and confidential sessions. So we have invested over 7,000 hours in this program, and through these services, we have had over 24,000 encounters. We've provided 1,500 plus hours of training, and we've offered 530 groups. 400 of those were more the team processing groups, and 130 were critical incident responses. And we've provided over 2,500 individual sessions. So we've worked with frontline staff as well as leaders, and Overwhelm, fear, exhaustion, and reactivity are everywhere. It has been interesting, though, because the one thing that we found that's really combating this is connection. Folks want to know that they're not alone and that what they're feeling, there isn't something wrong with it, and that there are tools and approaches that can help them move forward in a more positive way. And this is from direct feedback with the folks that we are working with. These are just a few examples of the massive amounts of feedback that we've received that clearly highlight the importance of offering connection opportunities within our workforce. People need support. They value empathy, and they want to grow their resiliency skills. So can you all read that? I'll read just a couple. I'm following up to thank you for your time. It was so helpful to share where I'm at and what I'm facing, and I thank you for listening and offering encouragement and advice. I've come to appreciate all the resources that they, Strength in Me, provide. These services in and of themselves represent a powerful message that healthcare workers, that they are truly valued members of our communities. So it has been such a privilege to witness and support the evolution of healthcare and frontline workforce needs over the last 3 years, and we wanted to bring some themes to the forefront today. Both high-risk areas that we've seen regardless of sector that we've worked within, healthcare and frontline, also the approaches to these areas that we have found to be successful. The first year of the pandemic, most of the workforce was in mission mode, right? Pivoting within an inch of sanity to meet needs, to stay safe, to follow guidelines. We went to work, we felt compelled to do what we could, and then we were afraid to go home. Were we going to have our families be sick? The second year, there was an added layer of feeling like, oh, things are getting a little better. And then a new variant would sweep in, and we were back to square one. In addition, at this time, folks seemed to shift into kind of a pandemic burnout where they were over even talking about it to the point of almost denial. Over this past year, sort of since the official end of the state of emergency, we've identified primary risk areas as reactivity, us versus them, and frontline leadership skills. Folks are struggling to move away from a reactive headspace. It's almost like we've been reactive for so long that it's hard for us to slow down and respond. I'm sure you're seeing this some in your workplace. We're so used to going from one thing to the next thing to the next thing that often errors might be increasing. Increased escalations between coworkers, patients, and healthcare staff. This high level of intensity removes our ability to have grace and patience with each other. Us versus them. We are seeing an increasing divide between frontline leaders and administrative leadership, often fueled in part naturally by the financial pressures that healthcare is under. Administrative leadership is trying to keep healthcare operational, and frontline workers are feeling like that their primary value is productivity. While we know that frontline leadership skills, it's not new, many frontline leaders and supervisors are lacking the skill sets to manage our teams effectively, whether that is avoidance of difficult conversations, which is really easy to do, boundary struggles, addressing negative attitudes, etc. We found that in part this is due to a lack of time and resources to develop leadership, right? While navigating staffing shortages that we're experiencing today. Folks are stressed, and when they're stressed, our fuses are shorter. Leaders are stressed. When leaders are stressed, their fuses are shorter. It's impacting our teams. All three of these risk points are impacting staff retention and resiliency at high levels based off the feedback that we're receiving from workers and leaders. So with that being said, we've learned and can recommend some practical and realistic approaches that can move these risk points into areas of opportunities for organizations. Firstly, the language that we use is critically important. The amount of members who have said to us, if I hear the word resilience one more time. It's almost like it's become triggering to folks, right? We believe that this is related to the idea that many people think of resiliency as like elasticity, right? The ability to bounce back. When in fact, we can't bounce back here. Life pre-pandemic does not exist. Same for the term self-care. It can feel like a completely unattainable concept for many. However, the skill sets remain the same. So even though we are shifting how we are talking about these things, we already know some things that work. One of our most popular and well-received trainings, if you can believe it, is actually on resiliency skills. However, we shifted it about a year and a half in to recalibration skills due to the feedback and reactions that we were receiving. Same training, same tools and tips, different language. And people love it. They love it because the language shift highlights their own locus of control. We are the only ones who can recalibrate ourselves. In supporting our workforce, noticing how we talk about things, what language seems to be triggering or worn out or we're getting a reaction from, is a quick and easy way to reframe messages in a way that people just may be able to hear it better. They can choose to recalibrate or change the way that they do things moving forward versus trying to bounce back when it feels like our elasticity is worn out. One of my favorite bits of wisdom is from a CNA who around reframing their expectations of what self-care looked like for them. And what they said was, maybe self-care looked like picking things up before, but now it looks like setting things down. When we can empower our workforce to recognize that they are part of rebuilding and reconstructing healthcare, and this may include adjusting our own pre-pandemic expectations of ourselves, it promotes sustainability. One of our most successful reframes that we have found when working with leaders is a language shift around positive workplace attitudes. It is okay not to always be positive, right? Is that even attainable? I mean, I like to think I'm a positive person, but I'm not sure everyone would agree that I'm positive all the time. So we've found that a simple shift to constructive is more useful. Based on feedback, when leaders shift the language from positive to constructive, workforce members share feeling that the expectations from their leaders are more realistic and sustainable. And the leaders are noticing less friction. Win-win. A last note here when it comes to recalibration. It's important to remember that how we are talking about things influences the culture of our workplace. And staff retention increases when culture is tuned into workforce needs. Okay, I could talk a while about all the other things that we've learned because our Maine workforce is wise. And they know that support, connection, and recalibration are critical to the sustainability of their work. And they will often mold to the actions of their leaders, particularly our frontline leaders. So here are a few recommendations for employers and leaders in workforce resiliency and retention. Offer and keep offering support, even if it's not immediately utilized. Many leaders will become discouraged if employees are not using services in the way that they think they should. And yet, this service goes so far when organizations care for their staff in this way. Provide coverage so staff can attend critical incident responses or other processing groups that are brought to the campus. Support self-care appointments within work hours, if at all possible. EAP sessions, coaching sessions, and I understand we can't always do everything all the time, but thinking about things and offering when we can is critically important. Use pre-standing meeting times to normalize conversations around staff sustainability. Give employees space to process and know that you may not be the best person for them to do that with. doesn't mean you don't care. Know and use the resources available to you, like Strengthen Me. Also, create and invest in intentional opportunities for connection. Because we know the more connected staff are, the less likely they're going to leave our organizations. Potlucks, baby showers, recreational sports, or whatever else you come up with that fits within your organization. But the goal is to build connection. Be present and visible. Maybe take an hour each week to be in the weeds. Maybe take an hour each week to be in the weeds. Did that send a little shock through anybody? Like, seriously? Do you really think I have time? I can't even get my job done now. Trust me, it will be well worth your effort. When frontline staff know their administration, morale and retention increase. I'll give you a quick example. A VP came down to help wash scopes at a urology practice that has been understaffed and that had a couple of call-outs that day. The staff are still talking about it 5 months later. It matters. The more visible leaders are, the more it's an us and the less there is a them. And lastly, model sustainability. If our boss is telling us to take a lunch and they never, ever, ever take a lunch, it's about modeling to staff that it's okay for them to take care of themselves, which actually we may have to take our own advice. So to move from a reactive to a responsive, we're going to need to recalibrate our own expectations and allow space for recovery, including renormalizing it in our workplaces. There was a time when we had to react to everything, right? And now we have a little more of an ability to pause, to consider, and to respond. So let's use this to model resiliency. Again, what I've presented today is based on our work over the last 3.5 years that we have supported healthcare workers, frontline workers all over Maine through the Strengthen Me partnership with the state of Maine. We are currently funded to continue our work through March of 2025. So please know that we are here to support you all if needed in building your staff and leaders' resiliency. The time to reach out to us is now. You can locate us through the state's Strengthen Me website. A quick Google search will get you there, or you can give us a call or an email at the information on the slide. And please know that we are here for you as a truly valued member of our Maine community. Thank you.
Thank you. That makes me want to take a very deep breath, which we should all do.
Yes, we should.
So, questions? Anybody have questions, comments? Does this resonate for you in your workplace? We all need to kind of do very much what Sheila's been talking about. Any questions? It'll be on now in a second.
While folks are thinking about their own questions, just want to highlight the fact that this is inclusive of all of our healthcare workforce, so that includes the behavioral health, long-term care. Yes. This is not just something specific to one sector of the healthcare workforce. So if you are feeling that your team is a little crispy, the resources are also available in our packet.
Thank you.
Good. All right. Thank you. So, we are going to take a break, and when we come back, and when we take our break, we should all model everything Sheila just said in 15 minutes. That would be modeling it, right? Not. When we come back, we have breakout sessions. So, and Joy, I need to make sure I have this right. Expanding the talent pipeline is in here. Strategies for recruiting rural providers and growing your workforce through training collaborations are, again, there's signage out the door and around to the side. So we are going to come back at 1:45 into our breakout sessions. After the breakout sessions, there will be a break, and you will come back in here to hear the wisdom of Mark McInerney on what the labor market is telling us. So we will see everybody in breakouts at 1:45. All right, folks, we're going to get into our breakout sessions. If you want to be here for, what is our session called, the pipeline?
Expanding the talent
Expanding the talent pipeline. Welcome to my post-lunch problems. Stay here. And if you are doing that, I'm going to ask you to please move forward if you are here for that. We don't love talking to a way out room, so come on in. There's plenty of room up here. It would be great if you would move and come on up. Otherwise, into the other rooms. Come on, you can move up from the back. It's all right. Do you guys bite?
No.
Oh, bummer.
Not recently. No.
I have to say, I was really tempted to have us all do a deep breathing exercise after that last presentation, right? In work that I do in other forums, we actually have somebody who comes in and gives us 5 minutes of wellness. Come on forward while I'm talking. I'm talking until you move forward, by the way. And it makes a tremendous difference to get present when somebody has asked you to kind of come and be present for a moment. So, all right. Thank you for moving up. Appreciate you. Listen, if there was a tray of cookies, I wouldn't let any of you come up because I would take them all. You have no idea my sugar proclivity. It's pretty bad. Alrighty, so with no further ado, we are going to go through the full talent pipeline, beginning from getting engaged all the way up to bachelor's. So I'm going to turn it over to our panelists. And we're going to do, they have about 10 minutes worth of presentation each, and then we'll do some Q&A. Does that sound good? You want to just go ahead and introduce yourselves? Or do you want me to introduce you?
Oh, I thought you were doing.
Oh, well then I have to get a piece of paper. I'm telling you, I'm having the post-lunch moment. Hold on. I'm supposed to introduce them, and of course I forgot to bring the paper. All right. So, we are starting with Lisa Vermette, who is from the Healthcare Career On-Ramp. Then Sherry Wilkins from the HOPE program at DHHS will talk. And then finally, Kathleen Simmons, who is with the Northeastern Rue Institute on their nursing pipeline program. Or, I'm sorry, your first year. Nursing. Not nursing. Sorry, I know exactly what it is. Your gap year programming, yeah. Is that better? Okay, here we go.
I'm technologically inept.
Press the green button.
Oh, the green button, okay. Good afternoon. Has everyone had a great day at the conference? Awesome. So my name is Lisa Vermette, and I serve as the Senior Director for FedCap Maine, the Senior Director of Education and Training. Or not. Okay. So FedCap Maine is a partnership with DHHS, the Office of Family, Children and Families. And our mission, it's to inspire people in Maine. So FedCap is part of the TANF Aspire program administered by DHHS. And once an individual has completed eligibility for TANF, they work with FedCap Maine for the Aspire program. So we help them get into pathways and into careers. So there are two ways that we've answered the call. Working with participants to enroll them in Parents as Scholars, so those going off to higher education. We have a lot of participants that come in and they want to be in healthcare, they want to be nurses, they want to be pharmacists. And the other way is we have a lot of participants that don't want to go off to higher education, so we created a pathway for the employers. I heard your call. We enroll participants in what we created as a career development industry-specific on-ramp. So Parents as Scholars is, it's a tool to provide alternative means for achieving higher ed. And our great partner, JMG, so we work with them to help enroll our students, get them into the pathway they want for Parents as Scholars, and then they have course navigators so we can see them through their completion of their program. And then we have Parents industry-specific Power of Possible. So that is a 90-hour industry-specific job readiness training. 60 hours of the training are all those soft skills I heard you say entry-level workers are missing these days. Communication skills, how to dress for work properly, how even to interview. So in those 60 hours, we get them job ready. But 30 hours is spent specifically for an industry-specific career pathways. And healthcare is actually our biggest industry right now, with a lot of people enrolling in that one. Each industry-specific on-ramp includes career ladders, the pathways of insertion, because many of our participants come with different, experiences. Some of them are coming from other countries. So we help them figure out which insertion point is great for them. There's a lot of networking. We have had field trips and digital literacy. Digital literacy is a skill that is lacking in a lot of our participants. So we make sure in every single class we build in digital literacy, so when they come out, they're more job ready. And opportunities for internships, field trainings, and further education. So a lot of our networking partners, they come in, they talk to the students. They could be from different education providers and different employers that offer that earn while you learn programming. So healthcare and human services placement. So since January of 2021, we've had 632 placements in the healthcare sector. And home health aides are the largest, and PCAs are the largest enrollments for jobs, coming from the on-ramp into the different jobs. And I won't read all the data to you, but happy to share it. So Families Forward healthcare industry impact. 32% of our graduates from our on-ramp program, they go into other areas. So they could be volunteering. We work with a lot of new Mainers that do not have their work authorization. So they might go into a volunteer opportunity, a field training, to kind of build some skills while they're waiting for that work authorization. We've had 18% go off into education programs. 32% go into internships right out of our on-ramp program. And 18% go right into employment. That was a very quick overview, but I think we're going to take questions after. Oh, okay. Now?
No, I think after, if that's okay.
Perfect.
Hi, everyone. My name's Sherry Wilkins. I'm the HOPE Program Manager from the Department of Health and Human Services, Office for Family Independence. So the first thing I'm going to ask everybody is to look on the table and see if you can find these 3 handouts. Because this is really important information, and if you really want to think about how the HOPE program is expanding Maine's talent pipeline, these are some great overviews. And like Lisa's programming with FedCap, the higher opportunity for Pathways to Employment is creating new talent and helping people get into the workforce. And so for all of you employers who would like to know how to get your hands on our May and June graduates, this piece of paper is really important. All right? All right. So we have some people who, in the back, the woman in the green has some packets for you. So you ready to share some hope? All right. So what is the HOPE program? Stands for Higher Opportunity for Pathways to Employment. This is a relatively new workforce development program that focuses on parents who are engaged in training and education, post-secondary training and education. So
what we do is we offer support so that parents stick with their programs and they earn those credentials, right? So we keep on hearing today about those workforce gaps. The really great thing about this little program is that our aim is to add credentials of value to families that increase their economic prosperity, and having their skill set then helps fill those gaps in Maine's workforce. The majority, we have 508 parents who are engaged in some kind of training and education beyond high school, and that's earning credential, certification, licenses, associate, and bachelor's degree. The majority of those students are enrolled in the health sciences, all right? So the goals of HOPE are really awesome, right? So we know that our parents are really brilliant people. They're not going to start training or education unless they know how they're going to pay for it. Knowing about HOPE's financial supports and our wraparound supports offered through our navigators help people decide that they can either begin or continue higher education. So help us get the word out to people about the HOPE program, right? Increasing economic prosperity. HOPE's part of the commitment to growing the state's economy. Last year, the HOPE program helped parents earn 148 credentials of value. Since we launched in 2020, January 6, 2020, we've helped parents earn a total of 397 credentials of value. And the majority of those are nurses and behavioral health specialists, right? In that industry. All right, so stop and think about how many parents you know right now who are engaged in some kind of post-secondary education, all right? Once you get your mental image, think about how busy they are. They're busy parenting, they're busy studying, and for 62% of HOPE's 508 participants, they are also busy working. So I will tell you that our parents tell us that the journey to obtaining that credential is not a sprint, it's a marathon. And HOPE's role is to provide the types of assistance that help parents succeed, right? So you say, well, what kinds of stuff help parents succeed? Our parents access childcare. So when parents are working, studying, and parenting, they have poverty of time. The best thing we can give our parents to make them successful in earning their credentials is offering full-time childcare. We also help with gas money so they can commute from home to daycare, to school, to clinicals, and to work and return. We help them. How many parents have you seen trying to complete health science homework on a smartphone? They're doing it, but what we realize is a laptop is an essential student tool, so that we equip our students with a laptop, and then a laptop's not useful if you don't have sustained connectivity to the internet. And so there are a lot, so we give them $50 a month toward their internet. It's important for people to understand it's not just tuition and books. There are these ancillary costs to attending higher education, and that's what higher opportunity for pathways to employment is all about. We understand the extra costs that are factored in and that might derail our parents from earning their degrees, right? So on top of understanding that there are financial costs, sometimes it's not the money, right? Sometimes there are other things. And so for those other things, we have this fantastic partnership with JMG. JMG offers that guidance, that support, that encouragement. If there's an issue and you need a warm heart and a listening ear, then our navigators through JMG offer that. So we've got this really awesome formula, and we know it's working because our parents are sticking with their training and education, and they're coming out, and then they're immediately entering the workforce because people are saying, we need your skills. So it's important for you to know, who does the HOPE program serve? We're a statewide program. We have 800 openings. Currently, we have 508 parents who are participating with us. However, 40 of those people are on tap to graduate May and June. And then we received 22 applications in April. So you can see that it's always a fluid enrollment, right? So then who is eligible? First and foremost, a person has to be a parent of a minor child, right? They have to have the parenting rights and responsibilities of a minor child. Then secondly, they have to be accepted to or already enrolled in some kind of certification, licensing, apprenticeship, associate or bachelor's degree program that will lead to a job with adequate job prospects. We know that the healthcare industry definitely has adequate job prospects. We also have some financial guidelines. To be eligible for HOPE assistance, it's for people who meet the 225% of federal poverty level. So just to give you an idea, if you know you have a parent that you're thinking about, and they are a single parent with a single child, their gross income would be $3,833 a month, right? And and it goes up according to how many people are in their household. Also, there is an asset limit of $10,000, and we exclude the primary home and the primary vehicle. So again, I'm going to say, how many of you know parents who either want to go on for higher education or are already engaged in higher education? I think about the employers out here. Think about everybody's talking about upskilling and building. So think about your entry-level employee. They are working for you, and perhaps they're already taking 2 online courses a night. Stop and think, they're already paying for childcare. Doesn't it make sense for you to say, do they have a child under the age of 18? I know they're not making more than 225% of FPL. I know they're not receiving a monthly TANF cash benefit, because if they are, then you'd want them to talk to Families Forward and their Parents of Scholar program. So they're not receiving the monthly TANF cash benefit. And I know that they've just been accepted to SMCC's Associate of Nursing program. So those are the kinds of questions you need to ask people, all right? And when you do know someone, if you want to connect them with the HOPE program, then you want to also connect them with JMG, because JMG is the person, the entity that is really devoted to developing our partnerships, our collaborations, and connecting our graduates with employers. I'll get out of this. All right. Your animation. Yeah. Let's see. Hi, everyone. I'm Kathy Simmons. I'm the Associate Director of Health Programs at the Rue Institute at Northeastern University. And I just want to mention that Jesse Billingham, who is our program manager, is also here for the gap year program that I'm going to be speaking about. So I may be calling on him to fill in some blanks or additional details. So I wanted to start first just by talking a little bit about Northeastern University and the Rue Institute, because that's often a curiosity when we go to public presentations, because the Rue is one of the new academic and economic development entities in the state. And so we often face questions including, did you buy the baked bean factory? Which is true. We are building a new campus in the old B&M baked bean factory location in Portland, Maine, but that's not going to be open for a while. Currently, we're in a building that belong to WEX, which is on 4th Street in Portland. However, Northeastern University is actually now considered a global university. We have campuses at 14 different locations around the world, most of them in the United States and Canada, but we also have one in London, and it is a very dynamic university. The Rue Institute is unique in that we were founded because of the generosity and vision of David Rue, who is a Mainer. He was employed or a leader in the tech industry in California and came back to Maine and identified Northeastern as his chosen academic partner for building what would become an economic innovation and driving institution for the state of Maine. So he really saw that Northeastern, especially with the strengths around the technological, computer science, data science areas, would be an optimal partner for the future development of the economy in our state. So the way that the Rue Institute operates is really by this whole idea of talent pipeline, and doing that by building the tech opportunities and the tech workforce in the state, working with existing industries, but also building new entrepreneurial opportunities and education, both at the degree granting mechanisms and also certificate and just upskilling business to business programs. We also do research, and so we have partnerships with many industries and other academic entities, both in the state of Maine, but also outside. And then there's a whole entrepreneurship channel as well, which you might have heard of. In fact, last weekend we had something called a Start Summit up in Knox County, which was one of the offerings of our entrepreneurial vertical that focused on youth mental health in the state. So, and really partnerships are at the base of everything that we do. So some of our healthcare partners include Maine Health and Northern Light, but we also have partners with IDEX and WEX and many other industries across the state. So that's all context for sort of understanding how this gap year program that really is the focus of the talk today. I actually am part of the department or the vertical within the Rue Institute called the Life Sciences, Health, and Engineering. We really see that a lot of the work that is happening in the healthcare industry now is really interdisciplinary. It goes beyond health professions specifically and intersects with the people who are working in computer science and life sciences. And then we build with all of these other pieces of the Rue Institute's approach to education and economic development in the state, as I mentioned.
We also resonate with something that the Center for Rural Innovation has developed as just the essentials for building economic development and tech, particularly in any state or in any region. And I've circled the part where we fit into this whole mechanism as a health program, which is really that in order to have tech development, which is the RU's mission, or economic development, you have to have some of these fundamentals. So I just want to highlight that things like our gap year program, which really are to address the health workforce needs and the public health needs in the state, is fundamental to the RU's vision and the state's vision around building economic opportunity for people who live and work in Maine. So I probably don't need to mention, we all understand as people who live and work in Maine that there are really some fundamental problems with our current state, that lead to health disparities, in particular for people in rural parts of the state, as well as people who are new Mainers and other underserved communities. We also, as you know, have the oldest mean age of any state in the country, and we're one of the most rural states. That exacerbates the situation that we have around developing a health workforce. And again, if we're going to have economic development to benefit everyone in the state, we really need that foundational piece of the health workforce. So that's really the background for why our gap year program was conceived and has been executed for the first year. We were lucky to be awarded a grant from the Maine Jobs and Recovery Plan, which was a Department of Labor grant that was broader than just health workforce. It includes other sectors of the economy that were felt to really need to drive the economic engine of the state forward. We were one of the 2 health-focused awardees in that mechanism, and we are in our second year, just beginning our second year of funding and of the gap year program that I'm going to tell you about. So what is our gap year program? It's an innovative non-degree program that is for people who are college graduates. And the idea was to meet their needs as they are considering a career in the health professions by having them fill critical entry-level positions in the healthcare arena. So they come into the state, or they are from already in Maine. They take an entry-level position with one of our healthcare partners, and they help address the critical need that these healthcare delivery providers have in their workforce by committing to working for a year in that position. So many of these younger people, they don't have to be younger, but because they're mostly recent college graduates, are looking to build out their portfolio so they'll be a more competitive candidate for medical school, physician assistant, nursing, whatever field. Some are also just exploring. They think they want to go into the health professions, but they're not sure. And so this is a way for them to get that kind of work experience. The carrot, in addition to a full-time job with benefits from the healthcare service provider, is that we provide them with a $500 a month stipend for housing. And we've learned in our feedback from them that this is critical. This has led some of them to take jobs in Maine as opposed to going to Boston or another more urban setting where they would earn a higher salary. They have student loans to pay back, right? And they're anticipating going on for more education, so every dollar counts. We also do wraparound services to support them and help connect them to the healthcare industry where they will be able to get a job. So I'm low on time, so I'm going to go. These are just our healthcare partners. These are sites that we initially started with 5, and now we have 10 across the state. Our early partners were Maine Health and Northern Light in the southern part of the state, and then we have a number including the Knox Clinic and Oasis and the Vein Center, and then we have built from there. So we've been able to, and then we have 2 academic partners also, University of New England and University of Southern Maine. The program is open to post-baccalaureate students from any college in the United States. So though those are our two academic partners in the state, they're not our only partners. We've also been working closely with Colby Bates and Bowdoin, and then students from other colleges outside of Maine and outside of New England have also enrolled in the program. So the way it works, we are the first point of entry. An interested participant fills out a form, we screen them, we refer them to our healthcare partners. They then do the actual interviewing and hiring, and then we provide the wraparound services and support and the housing stipend over the year after they have been hired and begun the program. It's a rolling but cohort balance between people having, they come into the program at some point between May and August or early September and commit to 1 year. So we have a cohort, but they don't have to start at the exact same time. And this was our year one cohort. We had 4 students from outside of the United States in the program who joined, and then the array of states that they represented, and these were the colleges that were most predominantly represented. And then these are the positions that the types of training that they had, their background majors. And then these are the positions. In the first cohort, they were predominantly in these 5 healthcare partners in these roles. And we are just at the beginning of hiring. We now have 19 of our second cohort have positions in sites where they will be working, which included all of the 10 partners that we listed before. So I think I am out of time, but there will be time for questions, and thank you.
Thanks to each of you. So questions, and I'm going to start with one, which is each of you mentioned wraparound or support services. What are you finding to be the most critical wraparound or support service that is helping folks to move through your pipeline? And your mics are live, I believe. And think of your questions. We have about 15 minutes for questions.
Sure. I would say for wraparound services, can I just have the JMG 2? They are heading up the Hope Pass JMG Navigation Services. This is Kara Boone and Shannon Miklas. And I would say wraparound service has been equal about housing challenges and mental health challenges.
I wondered, and it made me think about the presentation previously about how to build in all that wellness work into because the mental health is everywhere now.
I would concur. We, all of our participants, their families, they have children under the age of 18, and it is housing and it is mental health as well. Those are the things that they're struggling with.
I think our population's a little bit different in that they really are in the career building pathway, and so really thinking about how to have a competitive medical school PA program application, or which profession do I want to go into. So really much more focused on career. We also, part of our wraparound has been really trying to expose people to rural health as a great place to work, and so we've been providing opportunities for them to learn about rural health in their
And Kathy, I don't think you mentioned this, but part of the goal of your program is to bring folks in from outside the state to build the healthcare workforce. So your focus on rural is a piece of that, right?
Right.
Yeah, just kind of noting that as one of the goals. Questions for? Yeah.
Thank you for presenting today. Through the HOPE program, you mentioned that one of the components was providing childcare. I am curious as to how you assist with providing childcare, especially where childcare providers are so scarce within, not only in the state of Maine, but within the country.
We take a pretty innovative approach. So the first thing is, as long as someone is matriculated half-time, that qualifies them for full-time childcare. And then we pay directly from the Department of Health and Human Services to the provider. And we pay the Friday before, so that on Monday the provider has an open door and welcomes the child in for childcare. And we will pay a licensed provider, an in-home licensed provider, so a center, a family daycare center, and we pay babysitters. And they're at different rates, and we pay up to the market cap. The Office for Child and Family Services establishes what a rate is for a child age 6 down to 6 months, and they're different rates, and they pay differently for whichever the provider qualifies for, center or family in-home daycare or babysitter. And for the HOPE program, we know that there are a lot of different living situations. So we have families who are two parents, two different families are sharing an apartment. And so we pay if this person is going to school and this person wants to babysit, even though they're in the same household, but they're unrelated, we'll pay them to look after each other's children.
Lisa, do you want to talk about how it works with Families Forward?
Because it is the same situation with the HOPE program, because our funder is Office of Child and Family Independence. So they have the same services. They receive childcare full-time or part-time. They can have a family member, so it's the same. But we offer childcare whether they're in the PASS program, Parents of Scholars going off to college, or if they're in our career development services that are on site. So.
And I have a question for the employers in the room. Just to kind of think about, I know the reason for this workshop in particular was interest by employers in a kind of pre-survey of the convening about how do we get access to these pipeline programs. So wondering for the employers in the room, if they're kind of how you get access to these programs, are you aware of these programs? How could we help you to become connected to them? So think about that for a moment. I wanted to ask Lisa one more question. Could you talk about the post-employment supports? Because don't you provide transitional support for a while after someone gets employment in healthcare? And what does that look like?
Our folks, they transition off, so they do not just receive a job and they have no support, because then childcare, and it's a big transition. So they receive transitional supports for childcare and for transportation as well.
And for how long? For how long?
I can't quote that at the moment.
I think it's 4 months. Not sure. Is it 6
6
now?
months.
It's 6 now. 6 months. Right, so then you've got built-in support. I'm sure it's true with Sherry and Kathy as well, but you've got built-in supports for retention, which the first 6 months is critical for retention, as you all know. Yeah.
I would just speak as an employer. Hang on. Yeah, sure. My name is Darlene, and I'm an administrator of an assisted living facility where we serve frail elderly people. So, and we have participated in a FedCap program. I'm somewhat familiar with HOPE. The issue for us was, assisted living is 24-hour care. And they come in at 9 o'clock in the morning, and they can go home by 3. They have childcare, those kinds of things. But those, again, once they leave, they're in a situation where, they're working with people that don't work 9 to 3, that have to work the overnight. that don't have childcare. So, to support an employer in a way that would be inclusive would be a better environment for everybody, and I think more successful. And we're desperate. We're desperate. Nobody wants to work nights. Nobody wants to work weekends. They don't want to work holidays. Grandchildren want to go to their grandchildren's practices. I mean, there's just so much competition that programs like that, however wonderful they are, and I do support them, they're not successful because of the environment you're putting those people into and for the people that are working. So I think there's a way to collaborate with something that could be more positive, that could work better for everybody, because we're in trouble.
Darlene, I do want to tell you that, so the HOPE program is a post-enrollment program. Someone has to have decided that they were going to change their stars, that they're going to enroll in training and education. So 62% of our parents are employed, and probably you're employing some of our people who are working the nights and the weekends and then going to nursing school in the day, right? And so what we're trying to do, really, really desperately trying to do, is we're trying to say, if you can find the childcare, we'll pay for it, right? And we pay for it, whether they're in school or in work, right? We're paying for all of it. No, but we're paying neighbors, we're paying elderly people, we're paying grandparents, right? So if they drop their kiddo off at Grammy or Grandpa's, we're paying them so that their parent can go to school and also go to work. We're trying to be really creative about how we support our parents, because we know it is not academics that is derailing people. Like I heard Chancellor Malloy say, 130,000 people started. They have the student loan debt, but they don't have that diploma. What we're trying to do is take away those barriers so that we aren't adding to that 130,000, that we're trying to think really hard about what might derail someone's education so that they keep on going. And one of the things you have to know is we are also helping people who already stopped out and they now have fees owed to their college. We're helping them pay those off so that they can get restarted again.
I do think, thank you, Sherry, and thank you for the question. I think what you also are pointing at is the disconnect, right, between all the supports and what's needed for a 24/7 environment, where very often the first job you get as a CNA is not Monday through Friday 9 to 5, because the folks who've been in for a while are the ones with seniority who get the Monday through Friday 9 to 5. So figuring out how the workforce system works with employers, and the support system that is being pointed at here is part of that dialogue that needs to happen, so that there's a realism about, if I'm going to be an ex-professional, I am going to start third shift. So I need to know that for a while and know it's not going to last forever, but it will be for a while. And so I think trying to find those kinds of solutions is helpful. Lisa, you look like you have a comment.
And I just wanted to add that I know in our career development classes, these are the exact conversations that we have. We prepare them. A lot of parents, they're two-parent families, so we talk about things like split shifts and things like that, and tapping into the neighbors and grandparents. But we have those very harsh conversations, so they are prepared and really work ready.
And plan for it, because I think it's the planning for it as opposed to, oh, the only jobs available to me are Saturday night jobs first. I didn't expect that, forget it, I'm not doing it. So by that planning moment that you're talking about, and maybe planning with local employers, it then helps to figure out that gap. I hope that was helpful, Darlene.
Working to find childcare for people that don't need these programs, but it's an issue. Transportation and childcare
Transportation and childcare. How many people feel like transportation and childcare are issues? Yeah, right? They're big ones. They're big workforce issues, and they're hard to solve right now. Any other questions? Anybody have? Yes.
This is a very technical question. Yeah, this is a very technical, probably. I just noticed that you say that you're, for the HOPE program, U.S. citizens are qualifying non-citizens. Is that somebody who has their green card, or what is the qualification? That's my first question. And secondly, the programs, do they have to be at a college, and what is accepted as a training program?
So I'll start with the second question. HOPE supports certification programs, licenses, apprenticeships, associate, bachelor's degree programs. And as long as we're a workforce development, so as long as someone can connect the dots between this is my program of study and this is the job I want to pursue, right, then that is a program. And we do stackable. So we have people who maybe were not successful in high school and they dip their toe in the water with a short-term occupational training, like maybe a CNA. And then they say, wow, I was really great at that. And then they can stay in our program and continue with those supports when they enroll in an associate program. And if they then say, I was really awesome and they want to enroll in a bachelor's, we will support them all the way through a bachelor's degree program. For the non-citizen piece, we follow the TANF rules for citizenship. So basically, we can work with asylees, but we can't work with asylum seekers.
Any last question? Any last comment? What would you like this room to take away? Each of you maybe 1 minute on what you'd like this room to take away in terms of all the work you're doing and how you hope to engage.
I'll start. Well, since many of you do represent employers, I would just want to emphasize that we are open to other partners. So if you have opportunities that you think would be appropriate for a 1-year commitment, there are gap year people who may continue on, but they'll get the support of this housing stipend. Then you can reach out to us. Our contact information is on the slide.
I would like our employers to know that there are going to be 40 graduates between May and June, and that if you are interested, I think it's important that you connect with JMG because they're the ones who are having those conversations right now with our graduates. They're very in tune to where they want to go and what they want to do, so that's a good thing. And then it's important for you to know we have 112 nursing students in the pipeline. We have 98 behavioral health students in the pipeline, 21 health science people in the pipeline, and we have dental assistants and all sorts of people. We are expanding Maine's talent pipeline.
Every month we have a cohort of folks that are interested in working in the healthcare field. They're from entry level, I want to work in the office, all the way up to I want to be in a CNA program. And then some of them we put in the parents of scholars because they want to be nurses. Every month we have people that are looking for jobs, and I'm fortunate enough in this room today we have 2 of our job placement people. So reach out to us. We have a pipeline for you. Many of them at entry level, many of them come with skills from other countries as well. So they are they're eager and looking for great employers with career ladders, career pathways. That's what we talk about every month. So reach out to us and we can get you connected. We also every month have networking events where we have employers come in and say, hey, here's who we are, these are the jobs, and this is why you want to come and work for us. So come and be a guest speaker. I know our job, our placement specialists, they're our placement team. They just had a really big hiring event in Portland, in our Portland office, and then a week or so ago in our Lewiston office. We have hiring events all the time, and we cover the entire state of Maine. So reach out. We have a pipeline for you.
Thank you. A round of applause for our panelists. So we're going to take a 15-minute break, and we have a request for you coming back in. You'll be coming back in at 2:45, and you'll see around the room partnerships, innovation, and I can't read the rest of it, new ideas, retention, and career pathways. When you come back, we're going to hear from Mark McInerney from the Department of Labor, but after that, we're going to be doing some work thinking about how to move work forward in these areas. So if you are interested in partnerships, sit over here. If you're interested in innovation and new ideas, please sit toward there, retention there, and career pathways here. So think about what's really sparked your interest here, and when you come back from break, please sit near the kind of area that you really want to engage in a dialogue with your peers about. There'll be a breakout session after Mark talks to really dig into these areas and see what you would like to both share and give with your peers. Thank you.
Really good to see you.
Slides should be loaded up just to...
They should, and if they are not yet, just look over there. As folks are filtering back into the room, if you are not sitting at a table that has butcher block paper on it, I'm going to encourage you to get up, move around, think a little bit creatively, because this is an opportunity for us to build on the learning today and also to think about where we go next. So we have Mark McInerney, who is going to give a presentation on setting the stage on some of the labor market information that we have, but then thank you. Then we're going to do some interactive exercises, and we're going to ask you to work with folks at your table. So I'm going to be very pointed before Mark gives his presentation and encourage you to think about what are some of the things you want to be focusing on, whether it's career pathways, if that was something that really spoke to you, or if it's retention is something that's really key and in the forefront of your mind, please move to that quadrant. We also have, I heard lots of innovative and interesting new ideas, so if you have some innovation and new ideas, please move over to that section. And then partnerships over in this front corner of the room. And thank you, brave souls who are willing to work on this. All right. As folks are finding their seats, I'm going to introduce Mark McInerney, who is the director for the Center for Workforce Research and Information. We're going to get started with this section. So I'm going to introduce our next speaker, who is Mark McInerney, the director for the Center of Workforce Research and Information at the Maine Department of Labor. Mark is an economist and the director of CWRI. CWRI's core mission is to inform the public about conditions and trends in the workforce. Mark joined CWRI in 2020 after completing his PhD in economics at the University of Connecticut. He'll give a brief presentation and then lots of Q&A from the room. So thank you, Mark.
All right, thanks so much for having me. I've got a presentation here that I'll plan to go through in about 15 minutes, just to kind of take a look at a high level of some of the recent trends that we're seeing, in particular some of the job and economic indicators that we monitor regularly, and then focus in specifically on Maine's healthcare sector, dive a bit deeper into some recent changes that we've seen in the state population, and understanding, the kind of the current state of Maine's healthcare workforce, the demographics of that workforce, and the occupational composition. And from there, happy to go through and answer any questions. So to start, here are some of the the kind of the indicators that we often assess to understand what's happening in the economy. And we'll kind of go through and highlight some of the key things that we've seen recently. First is the overall jobs picture, which is we have been on a path of steady growth. Of course, the pandemic led to such a widespread disruption in so many different sectors. Of course, it was a significant disruption to the healthcare sector. But since then, we have been on a pretty steady course of recovery. We have recovered the jobs that were initially lost during the pandemic through 2022, and we have just continued on a steady trajectory of growth from there. So overall, jobs are up about 3% relative to, the 2019 level, that last full year of data that we had just before the pandemic. And healthcare was really a bit of an outlier in that for most of the pandemic, the recovery had unfolded much more slowly, particularly the first 2 years after the pandemic. But since then, it has really accelerated. So over the last year, as an example, 60% of all the job gains across all sectors in the economy were within healthcare and social assistance after that somewhat slower recovery initially. Unemployment rates are quite low and have been quite low for an extended period of time. Unemployment rates have been below 4% for 28 consecutive months now, and that's the second longest such period that we've seen that level of low unemployment in the data. And then on the other side, job openings rates have tended lower after ticking up significantly in the first few years of the pandemic. So, in that period, there was this massive disruption. So many different sectors saw job displacements. And then all of a sudden, as we tried to return to normal or create a new normal economic environment, so many employers were seeking to staff up, but all at the same time. We saw this surge in job openings rates. But there's been more of a balance in the last year, 2 years or so. We have seen the balance between, on the one hand, the labor supply, that is folks that are actively looking for a job or connected to an employer. That labor supply has been coming into better balance with labor demand, which comes from employers that are seeking to recruit, to find folks to join their team. We've seen those two things come into better balance in the last 2 years or so, but it's still a quite competitive labor market environment where, there's still a relative imbalance between job openings, that is, there are more job openings relative to the number of unemployed job seekers out there in the labor market. So coming into better balance, but still a quite competitive hiring environment of more job openings than unemployed job seekers. And then finally, we'll look at how the state's population has changed, because that's been something that has been critical to understanding the bigger picture. We have seen a really rapid rate of migration, population increases because of folks that have moved to the state of Maine within the last 3 to 4 years or so. And that's been really important in understanding the overall job and population picture. So this first slide here, the first chart, documents the overall job trend, which is the blue line, what we've seen across all sectors, and then the red series, which is specific to Maine's healthcare and social assistance sector. And I've titled this A Tale of Two Recoveries, because it has unfolded quite differently within healthcare and social assistance. The way to interpret this chart is that the index level of 100 would represent, the number of jobs that were within that sector in 2019, and then each unit could be interpreted as a percent change. So across all industries, the pandemic led to displacement of about 15% of job holders in the early months. And then we began this course of recovery as employers across sectors tried to adapt to this new normal and to reopen their and regain business in a safe way. Similarly, there was a dramatic effect within the healthcare and social assistance sector. And that recovery has proceeded, as I mentioned, around 2022. We got back to that pre-pandemic job level, and across all industries, we've just been on course of steady growth beyond that point. But within healthcare and social assistance, it's unfolded quite a bit differently. That recovery began in 2021 and into 2022, but then it's really stalled out and slowed down compared to the growth that we saw overall. All of a sudden, within the last year or two, that growth has really picked up within healthcare and social assistance, which has added just under 6,000 jobs in the last year. And now all of a sudden, in healthcare and social assistance, the rate of recovery actually exceeds the trend overall. So in all industries, jobs are about 3% higher now compared to 2019, and within healthcare and social assistance, they're about 4% higher. So it's been a period of really remarkable growth, job growth, in healthcare and social assistance in the last 2 years or so. And if we take a look at, kind of how does healthcare fit into the economy overall, healthcare and social assistance make up about 1 out of every 6 jobs in the state. Now, to understand, why this has been the case, I think you really have to go below the surface and look at the various component parts of what makes up healthcare and social assistance in our data. So there are 4 major parts that some are more intuitive and some are less, so I'll go into a little bit of detail about what make up the component parts. The largest component is ambulatory health, so that includes things like offices of physicians, dentists, outpatient providers, and home health care providers, among other types of services within that category. Hospitals is a little bit more of an intuitive category, I think. So too nursing and residential care facilities. And then social assistance, which is something that we kind of tack on to the end of this sector title, healthcare and social assistance. It's, of course, a variety of very important social services that includes childcare services, services for individual and families, specifically for the elderly, disability, those with disabilities, and youth, other than healthcare services. The largest component parts, about 60% of jobs, are within ambulatory health and hospitals, and then the rest are within nursing and residential care facilities and social assistance. But this recovery has really unfolded quite differently across those 4 component parts. So of course, within hospitals and nursing and residential care facilities, at the onset of the pandemic in 2020, it was still essential to continuing to provide care, to continue to serve patients and residents in those facilities. So in the early months of the pandemic, we saw very little disruption to staffing within hospitals and nursing and residential care facilities. But where we saw a dramatic dip in employment was among ambulatory health and social services, social assistance. So it could have been that employers had to close down temporarily, or certain types of services had to be postponed. But then we saw a recovery from there and a steady increase in jobs. It took a while for hospitals and for nursing and residential care facilities to recover, but this is where we're seeing that kind of later recovery that's happened within the last year or two, where hospitals and nursing care facilities have been successful in terms of increasing their staffing levels within the last 2 years or so. All right, so in order to understand overall job trends, I think it's really critical to understand the population structure and how it's changing. One of the reasons that the primary reason that we're in this very competitive environment characterized by low unemployment and a relatively high number of job openings for each job seeker in the labor market is because of our population age structure. And of course, this also affects the demand for a variety of different types of health services. The composition of our population by age. If we look at our current population age structure, it is quite imbalanced. If we make a comparison of the population between the ages of 25 to 54, which are often characterized as the prime working age population, they're outnumbered by those who are age 55 and over. And at around age 55 and over, but age 65 in particular, is where we start to see participation in the workforce tend to lower. And so because we have this somewhat of an imbalance between the population in prime working ages and those age 55 and over, we see overall constraints to workforce growth. And at the same time, I think this is important to understanding long-term increases in demand for services in a variety of different types of healthcare settings, because disability incidences or other types of ailments tend to become more prevalent with age, and that means that demand for services is expected to increase as a population ages. This is, I think, an important part of understanding why healthcare has become an increasingly important part of our economy overall. If we look at a long period of time, 3 decades, for example, in the data, healthcare has been one of the primary areas of job growth across all sectors. It's becoming an increasingly important part of the economy. Over that 30 years, for example, through 2023, healthcare has added over 45,000, almost 46,000 jobs throughout the state. That represents about 35% of all the job growth that has occurred since the early 90s. And we've seen some pretty dramatic changes recently in the overall population. On the one hand, the pandemic had this effect of decoupling to some extent place of work and place of residence. So many folks were all of a sudden afforded the opportunity to work remotely or to explore remote work opportunities. And so there was a concurrent shift in where people were choosing to live. And Maine was one of the places that greatly benefited from that migration that we started to see in 2020. Some of the recent in-migration into the state has been the most significant that we've ever seen, going back many decades. That net migration into the state, which I should just clarify, net migration just measures the difference between how many people moved into the state minus how many people moved out of the state. And the state population has really grown significantly because of that net migration in the last few years. The state population grew by 21,000 in 2021 through net migration, and it's continued, though it's starting to slow down a bit. The net migration in 2022 was about 16,500, and in 2023 it was 11,500. The migration that we're seeing is a mixture of domestic migration, so folks moving from other states into Maine, and international migration as well. But mostly what we're seeing in the data is that it's a lot of domestic migration, about 88% domestic migration, and about 12% of that is international migration. But the international migration component is becoming an increasingly important part of the state's workforce overall. So according to the most recent data that we have, it's estimated that there are about 30,000 folks in the workforce today that are foreign-born. That represents about 4% of the state's overall workforce. And the largest overall sector of employment for the foreign-born workforce is education and health services. About a third of the foreign-born workforce are employed in healthcare or education services. So it's an increasingly important part of the state's workforce overall, and of course healthcare is a critical component of the employment opportunities for folks who are recent arrivals in the state. And finally, we'll just take a little bit of a look at kind of a current snapshot of the demographics of the healthcare workforce and the occupational mix of who makes up the healthcare workforce. And then from there, we'll open it up to any questions. But I think it's come up in a few sessions so far this morning. It certainly stands out in the data that the current healthcare workforce skews quite heavily. There is quite a gender imbalance. About 77% of all job holders in the healthcare and social assistance sector are women. And the age makeup and the racial and ethnic makeup of the workforce is pretty similar to that of the broader workforce in all industries. It is similar to every sector. It is a somewhat older workforce. About 28% of job holders in healthcare and social assistance are age 55 or older. And it is a majority white. About 90% are white. 4% are Black or African American, 2% are Hispanic, and about 2% are Asian in the current workforce. And now to the occupational mix. What are the biggest occupational needs? What is the composition of the current healthcare workforce by occupation? And it's quite striking that some of the foundational occupations that have come up in multiple sessions throughout the day play such an important role in the healthcare workforce. If we look at the workforce, about a third are working in one of three occupations: home health and personal care aides, registered nurses, and nursing assistants. And the rest are working in a variety of other high skill occupations, for example, practitioners, physicians, variety of different technical occupations and support occupations. Within the overall sector, those who have a specific area or a specialty in one of these health areas, that makes up about 60% of the total workforce in healthcare and social assistance. But of course, it's not just health-specific occupations that make up the workforce. There's so many other critical functions, including those who are working in office and administrative support, those who are working in community and social service occupations. A big group there would be child care workers. Food prep and serving, buildings and grounds, cleaning and maintenance, business and financial operations. Obviously, serving patients, working with patients is a very important component of it, but it's a much broader workforce that requires folks with a variety of different skill sets that come together to make up the workforce. So I'll just provide a snapshot of the two bigger components that make up healthcare and social assistance in Maine, and starting with hospitals. So this chart here shows the distribution of health occupations within Maine hospitals. And again, it's quite striking how how important some of the largest occupations are to the overall workforce and the day-to-day operations within hospitals. Registered nurses make up almost 40% of the total workforce that have either a health specialty, the type of workforce that tends to be working with patients or in a diagnostics role. 56% of the total workforce are made up of either registered nurses, nursing assistants, or medical assistants. Just a huge component of the overall workforce within health occupations and hospitals. And the rest are made up of a variety of different types of either physicians with varying specialties, technicians, support workers, each that make up overall a relatively small part of the healthcare workforce. And then just another snapshot of ambulatory care. But again, it stands out that some of those foundational occupations make up such a big component of the overall healthcare workforce. So about 38% work within one of the top 3 occupations among either registered nurses, medical assistants, home health, and personal care aides. All right, just a quick summary, and then from there, I'd be happy to take any questions. But at a high level, what we're seeing is pretty favorable economic conditions by many measures, characterized by steady job growth and growth in economic output, relatively low unemployment rates. That means that job seekers really have opportunities in many different sectors, and it puts the onus on employers to compete for that workforce. The labor market remains quite tight, and that is a very challenging environment for employers, but I think so many of the strategies that have been highlighted here today really speak to ways that employers can become more engaged or stand out within a competitive field for talent. So a lot of really important strategies that have come up today about how to think about how to operate and be successful in that environment of strong competition for workforce. Jobs in healthcare and social assistance were initially quite slow to recover in 2022 and kind of lagging behind the overall economic trend. But since then, the growth has accelerated, and now there is a much faster rate of growth in terms of jobs within healthcare and social assistance than the economy overall. And of course, healthcare significance has grown over many decades, and it's expected to continue to grow as a result of many factors, but one of which being the age structure of the population, which is expected to lead to an increased demand for a variety of different types of services. That demographic, the demographic factors that we discussed are expected to play a really important role in shaping workforce trends and job trends going forward. The population aging has been offset by really rapid rates of in-migration, just so many folks that have moved into the state of Maine in the last 4 years, and that has sustained the amount of job growth that we're seeing overall. All right. Happy to open it up to any questions from the audience.
Hi, thank you. Where does the behavioral health workforce fit into this when you're talking about health and social services?
So in terms of some of the different industries that we looked at, it often depends upon what type of setting that care is being provided in, whether it's within a residential care facility. That would often be within nursing and residential care. If it's in an outpatient setting, it often would be in ambulatory health. But then there's also services that are not necessarily health-specific services, but more community services that might fall into social assistance. So I think it kind of primarily depends upon the setting usually that care is being provided. But of course, behavioral health is an important part of many different components of the healthcare system.
So you think it's sprinkled in all the different, like when you look at the pie charts and the different roles, you think the behavioral health roles are kind of sprinkled throughout? Like
Yeah.
Clinicians and direct support workers. And,
Yeah, so direct support workers, for example, a lot of that would be within nursing and residential care facilities. And within our data, for the most part, direct support professionals would be classified as home health and personal care aides. And that tends to be, one of the most prominent occupations. It's actually one of the biggest occupations in the entire economy. But it could be, we do see workers within those roles within nursing and residential care facilities, home health care services. So it's, a variety of different types of settings. So it can be difficult to try to capture all those dynamics, in a single chart at times.
If you don't ask questions, I'm going to put you to work. Well, you guys look like you might be ready for an interactive activity. I'm just going to look around one more time in case. Oh, there is a question, Sally. Thank you.
I'm not going to be shy. So I'm just asking kind of a follow-up question from this morning. Have the Maine Department of Labor or your team thought at all a little bit about, we kind of know what it currently looks like. And you talked a little bit about that distribution of population, increased demand for services, as well as just that a huge portion of our workforce is 50 or older. I can't remember that pie chart, but 36%. Do we have a sense of what our future workforce needs will be? Like, has there been any projections that your team or the Maine Department of Labor has done around kind of looking forward? What would we need to backfill as well as grow to care for our population?
Yeah, so in our office, we produce a 10-year job outlook. And so that 10-year job outlook goes into the same level of detail for industries and occupations to project. One of the most important components of that to assess kind of, on the one hand, demand from a job seeker's perspective, like, am I training for a career that is expected to be in demand? And on, from an employer perspective or from the perspective of an educational institution, am I prepared for future workforce needs, or am I providing training based on future workforce needs? And so we do project for each occupation, the employment over 10 years and how many job openings we project within that occupation over 10 years. So I'd be more than happy to if I can, connect to that resource or the more ways that we can be a part of the conversation when it comes to, decision making about curriculum development or just, general education about workforce data. I think that is a big piece, is our job projection. So I'd be more than happy as well if I could provide more information about that.
And if I could add as well, one of the things I thought was interesting about Joanne's presentation this morning, coming from a different state and a different perspective, is we also need partnership from all of the employers to help us kind of zero in on some of that data. I'll use respiratory therapists as an example, and Sally, these trends as COVID increased that need, but that is something that wouldn't necessarily have been a blip on the DOL data without having input from the employers. So we just encourage these conversations.